Okay, so welcome everyone to the Usmle Step 1 lecture, Reproductive, lecture number 2 by Dr. Haidari. Thank you so much for joining the lecture. Hope you guys are doing well. If you guys can hear my voice, can I get a yes in the chat box, please? Yes or no? Okay. Give me 1 second. Okay, good. Okay. Can everyone hear my voice? Is my voice clear? Question number 1. Okay, good. Question number 2. Can everyone see my screen properly? Yes or no? Yes. Okay. Very well. So let's begin the lecture for today. The lecture for today is that we are going to continue our discussion of the reproductive embryology. We are on the goal of finishing embryology and starting anatomy today. So without any further ado, let's load up our first aid and begin the lecture. While I do this, do you guys have any questions for me? Yes or no? Dr. Sana has a question. I hope all is well. Can you please share the folder for biostatistics? Okay, we will upload the folder on Google Drive and we will share the biostatistics folder with you all today. Okay. Is everyone ready? Yes or no? No. Is everyone ready to learn about the pharyngeal arches? Okay. Before I jump into the discussion of pharyngeal arches over here, can we do a quick revision and recapitulation of some of our reproductive topics that we have studied the day before yesterday? Yes or no? Very quick questions, quick answers. Are you guys ready? Yes or no? Okay, so one more time. Is everyone ready for a quick revision and recapitulation of the topics from the first class of the reproductive system? Yes or no? Yes. Okay, good. Number 1, what is the name of the gene that is responsible for AP axis pattern of your limbs? Fast answers, please. Very good. What is the name of the gene that is responsible for dorsal-ventral axis of your patterning of your limbs? That is WNT7. Very good. What is the name of the gene that is responsible for limb lengthening? Limb lengthening, FGF. Very good. If you have one segment of your body in another segment, in another position, for example, let's say you have a finger on your face, what is the abnormality of the gene for which this has resulted? Very good. Cox mutation. Okay, very good. The cardiovascular system, the renal system, the pleura, the pericardium, the peritoneum, where are they developed from? Mesoderm. Notochord, where is notochord developing from? Notochord. Very good. Spleen, where is spleen developing from? Spleen. Spleen. Spleen is a mesodermal development. Very good. Thyroid, thymus, pancreas, gallbladder, liver, lungs. Very good. Lens, ears, nose, mammary glands, sweat glands, surface ectoderm. Very good. Adrenal medulla. Adrenal medulla. Adrenal medulla. Okay. Peripheral nervous system ganglia. Okay, good. Quick questions about some teratidins very quickly. ACE inhibitors and ARBs will cause what teratogenic effect? Renal failure. Very good. Aminoglycosides will cause what effect? Fast answers, please. Aminoglycosides will cause ototoxicity. Very good. Okay. Diethylstilbestrol will cause what ototoxicity? Will cause what problem? Diethylstilbestrol, virilization. Fluoroquinolones will cause what problem? Okay, then next one is tetracycline. Not tetracycline, my apologies, warfarin. Warfarin. Warfarin will cause what effect? Okay, next one, fetal alcohol syndrome. Can anyone tell me the fatal features of fetal alcohol syndrome? Intellectual disabilities, smooth syndrome. Okay, good. Okay. Next one is if there's a child who is just born who has shivering, high-pitched crying, irritability. What is the problem with this baby? Opioid withdrawal. Okay, good. If I tell you that over here you have two ovums that are fertilized by two different sperms, what type of a twin do we have over here? Dizygotic, diamniotic. Are they fraternal twins or identical twins? They are fraternal twins. Very good. Okay. If one egg is fertilized by one sperm and there is splitting of that, totipotent cell, what is the name of this sort of a twin? Is this identical or fraternal? Yeah. Identical. Okay, next one. If the splitting happens in the first 4 days, what is the name of this sort of twin? Very good. If the splitting happens in 4 to 8 days, what is the name of this sort of twin? Okay. What is the most common type of identical twin? Okay. If the splitting of the zygote happens after 12 days or after 13 days, what do we call these sort of twinnings? Conjoined. Very good. Okay. So far, you guys remember most of the high yield information, and for that, I'm very grateful. I'm very proud of you guys. Thank you so much. Now, today, we will begin our discussion of the pharyngeal arches. How to remember effectively what are the muscles, what are the veins, what are the cartilage, what are the arteries, what are developed from these pharyngeal arches, pouches, and clefts. After that, we will talk about sexual differentiation that based on the presence or absence of the SRY gene, babies will either be males or females. So we'll talk about that. We'll talk about some other things before we take a break for 15 minutes today. We will make sure that we finish embryology. Now, is everyone ready to begin one more time? Yes or no? Are we ready? Okay. Now, before I start talking about the pharyngeal arches and how they are developed, I just want to quickly touch base of the steps of embryology. The steps of embryology are very simple. First and foremost, we have copulation. What is copulation? Copulation is sexual interaction. After copulation, we have conception, right? After conception, we have fertilization. Fertilization is the process of fusion of the female eggs with the male sperms. After that, we have the formation of the zygote. Now, in the zygote, we have a couple of things. By the week 3 of the zygote, the zygote starts to look something like this. Okay? The zygote, they start to look something like this. Very roughly, you have the notochord that induces the overlying ectoderm to form neuroectoderm. So, and the notochord and the neuroectoderm, it goes downwards to form your neural plate and your neural tube. And then you have your ectoderm, mesoderm, and your endoderm. At week 4, by week 4, the developing embryo now looks a bit like this. Okay. The developing embryo looks a bit like this. Now, this embryo at week 4 have more or less everything, except this structure is only turning. That's. So this is another step of the morphogenesis of the embryo. That is, by week 4, you have the turning of these structures. When the structure turns like this, once again, you have the neural tube over here that will give rise to your brain, your spinal cord, and the cells of the central nervous system. And you have the neural crest that will give rise to motile passes, right? And then you have your mesoderm, your endoderm. And if you can notice very quickly, you have these folds over here. These folds are right opposite of your cardiac stoma, okay? In the upper part of the developing embryo. So over here, this is at week 4, you have these foldings called the pharyngeal apparatus. If you take a section of this, for example, let's say that you want to visualize this, right? So you cut this portion, okay? You cut this portion of the embryo and you are visualizing the embryo like this. If you visualize the embryo like this, what you will see is this structure. This is the structure that you will be looking at, okay? Now let's talk about this structure over here very quickly. This is the structure of the pharyngeal apparatus. The pharyngeal apparatus consists of CAP. CAP stands for pharyngeal cleft, pharyngeal arch, and pharyngeal pouch. All 3 together are called apparatus, pharyngeal apparatus. Now, as you can see over here, that these are your arches. The arches means that these extensions are called arch. In between 1 and 2 pharyngeal arch, you have a small depression over here called the pouch. This is the pharyngeal pouch. And on the external part of the pharyngeal apparatus, you have this groove. This groove is called the cleft. So this cleft, this pouch, and this arch, all of this together makes your pharyngeal apparatus. Now, in between or in the pharyngeal apparatus, as you can see, each of these pharyngeal apparatus, you have a designated cartilage, a designated nerve, a designated artery, a designated muscle, right? Even they have done the same thing, which we have done over there. Over there, this is the same thing that they have done. They have visualized this structure on a coronal cross section. Now, each of these pharyngeal arches, they have their own cartilage, own nerve, own artery, and own muscles. And from these things, you have the development of the muscles, vessels, nerves, and everything else. So for example, the muscles of the first pharyngeal arch will belong only to the first pharyngeal arch. The muscles of the second pharyngeal arch will only belong to the muscles of the second pharyngeal arch. So they are designated for each of them, for each arches. So that's that. Okay, just give me 1 second, please. Okay. So that's that. Now, very quickly, I just want to touch base on where are these arches developing from and where are these clefts and the pouches developing from. The clefts, arches, and pouches, the cleft, since it's an external structure, they are developed from the ectoderm. Okay, please put your, I'll use my red marker for this. The clefts, since they are the external covering, the clefts are derived from the ectoderm. The arches, they are derived from the mesoderm and the neural crest. And the pouches, since they are an internal structure, they are developed from the endoderm. Have I made myself clear? Yes or no? It's very easy to understand, right? External clefts are external. That's why ectoderm. In the middle, you have the arches. That's why mesoderm. And outside and inwards, you have a pouch. That is endoderm. Will it be easy to understand now, since you know where the clefts are, where the pouches are, that in which part of neural of the gastrulation week 3 do they develop from? Yes, the answer is yes. Okay, so this is a high yield question. Do not miss this question in your exam. Always remember clefts. Just try to remember this diagram over here, which clearly states that the cleft is outward, the pouches are inward, and in the middle you have the arch apparatus. Okay, so that's exactly what they have said over here. That pharyngeal clefts, they are derived from the ectoderm. Arches are derived from the mesoderm, and the pouches are derived from the endoderm. That's simple. Now, let's talk about this pharyngeal cleft derivatives. Oh, you have first, second, third, fourth, and sixth. Where is the fifth one? Can anyone tell me where is the fifth pharyngeal arch from your previous knowledge of bachelor embryology? Where is the fifth pharyngeal arch? The answer is that the fifth pharyngeal arch obliterates. There you go, Dr. Ethan. The fifth pharyngeal arch obliterates before development. So the fifth one disappears and the sixth one remains. Okay. Now, pharyngeal cleft derivatives, meaning that what are the adult derivatives of the pharyngeal cleft, the ectodermal development? The first cleft over here, this is very important. The first cleft will develop into your external auditory meatus. The first cleft will develop into your external auditory meatus, meaning that what is the external auditory meatus? The external auditory meatus is the opening of your ears through which the sound passes into your middle ear cavity. Have I made myself clear? Yes or no? External auditory meatus means the outer portion of the ear. The second through fourth cleft, the second and the fourth, meaning 2, 3, 4, they form temporary cervical sinus, which should obliterate. If for any reason the temporary cervical sinus persists, then we have a very high yield lateral neck swelling. This lateral neck swelling is known as persistent cervical sinus. It presents itself with a very big lateral swelling over here. So if this is your patient, then the swelling is on the lateral side of the neck. This is known as persistent cervical sinus, or we call this a branchial cyst. You can call this pharyngeal cleft cyst, branchial cyst, or anything else. A very quick example of this. Okay, I'm going to show you the example in 1 second. Just give me 1 second. Okay, let me just show you branchial cyst. Okay, this is an example of a branchial cyst. Okay. If you see something like this and they ask you, what is the embryological disturbance or abnormality of this patient? The embryological abnormality is that the second to fourth cleft did not involute. Have I made myself clear? Yes or no? Yes. Have I made myself clear? Okay, very good. Now, let's come to the pharyngeal arches, their derivatives. Now, each of these pharyngeal arches, as you can see over here, each of these arches, they have a cartilage medially and laterally. They have a nerve, they have an artery, and they have a muscle. So it's very, very important that we learn what are the muscles, what are the nerves, and what are the cartilages that are arising from here. And there are two very high yield diseases that are associated with abnormal development of your pharyngeal arches and your pharyngeal clefts. So how do we remember all of this high yield information? Because do you guys remember that during your bachelor's of medicine and bachelor's of surgery, you have tried your best to remember all of this, but you could never succeed? Yes or no? Yes, there were multiple times when you read this, but you remember this information only till the day of your exam. And then right after your exam ends, so does your knowledge and your memories about the pharyngeal arches. And it's not only you, it's also me and also the rest of the medical students in the world, right? So how do we remember this effectively? Very quick thing over here. Do you remember reading books more? Or do you remember, for example, do you remember a certain situation of a book way more? Or do you remember a certain scene of a movie easily? Which one? Which one is easier to remember? A scene of a movie or a scene from a book? The answer is a scene from a movie. The answer is why? It's a very simple answer. The answer is because when you visualize something, that visual information is stored very easily in your limbic system, right? If you read something, then your brain has to work twice as more. Your brain has to turn your words into a scene, and then that scene gets stored in your limbic system, because your limbic system do not store words, right? Your limbic system maybe stores a visual image of the book, but your limbic systems are more designed to remember visual images easily. So that's why you remember scenes of a movie, but you do not remember scenes or paragraphs from a book. So that's exactly what we are going to do today. We are going to use a visual mnemonic video that will allow every one of us, including me, to sort of relearn the pharyngeal arch derivatives. Before I took the class, I already saw the video myself because I wanted to prepare myself if there were any questions. So I already revised my portion of the video, but I'm still going to watch the whole thing with you guys. It's very little. It's not going to take a lot of time. You have a 10-minute video for pharyngeal arches and I guess another 10-minute video for the pharyngeal pouches. So that's that. Are we ready to begin? Yes or no? The video. Okay. I would advise everyone to wear a headphone so that they can hear the sound more easily. And if they cannot hear the sound, then please, they should let me know. And I will try to do my best to accentuate the sound and everything else. Okay, so without any further ado, let's begin. This is a recording from one of my classes back in 2020, almost more than a year ago, that I took with my first batch. Over here, I have the same video I used for physio. So that's exactly what we're going to do. Just give me 1 second. Okay. 1 second. Is everyone ready? Yes or no? Okay, so let me know if you guys cannot hear or see the text or the images. Okay, 1 second. Asked during the USMLE step 1. Okay, so what we are going to do is we are going to watch the video. Okay, we are going to watch the video, and then when we come. Okay, this is not me in the present. This is me in the past. Okay, so are you guys ready? Yes or no? This is going to start right now. Okay. Okay, so best of luck. Please let me know if you do not understand anything. Okay. Here, we will pause, and you guys will take a snapshot, and we have Dr. Karbasi, who is responsible for taking the snapshot, and
he will provide the picture in Dr. Heidi's step 1, but please try to take your own snapshot. And that's that, okay? So without further ado, before we jump into this text over here, we will watch the video because these are all the things which we will master today up to here, more or less, up to here, and then we can move on with the regular first aid. But for everything to understand and master and memorize, we will use this here. Okay, so let's begin.
In pharyngeal arches. Let's get started.
Okay. Can you guys hear the voices? Can you guys?
Okay, this is me in the past once again. Okay, so this is me in the present right now, who's speaking to you guys. You have a little bit of a table from physio, which you do not need. So I'm just going to go forward a little bit. Okay, so you guys do not need this anymore. This was from the previous syllabus. So let's move forward all the way to over here. Okay. Can you guys hear the sound properly? Yes or no? Fast answers, please. Can you guys hear the sound properly? Yes? Okay.
Reference, and it provides a nice overview of information. All right, with this in mind, let's dive into the image mnemonic.
Okay. Okay, so please take a picture of this. Okay, please take a snapshot of this one and keep
Sandstone arch.
In physio. You can use this as a short review and recapitulation, but always refer to first aid. Never refer to this for solving your questions. Okay.
I'm not going to read this to you because we'll cover the information in the image mnemonic. However, it may be helpful as a quick reference, and it provides a nice overview of information. All right, with this in mind, let's dive into the image mnemonic. This scene will take place at the Arches National Park, which is a pretty cool place in the state of Utah that has tons of.
Okay, so this is the beginning of the video mnemonic. This is the picture that you need to remember. This is the pharyngeal arch, and everything that will happen around this area will represent what happens in the pharyngeal arch. So please put your utmost attention to this video. I have two questions. Number one is the sound okay? Yes or no? Best answers, please. Yes. Next one, is the screen okay? I know it's a little bit blurry, but is it good enough for you guys to understand what's happening? Yes or no? Okay, so let's begin. Please put your attention to this. After this, I'll share a picture of this in your discussion group so that you can refer to this. So for now, watch the video and try to learn as much from this as possible.
Natural sandstone arches. We can see those arches very prominently in the background of this image. On the left, we can see one big arch, which apparently is a nice location for a wedding. This singular arch on the left will represent the first pharyngeal arch. On the right side of the image, we can see two arches right next to each other. So the information near these two arches will represent the second pharyngeal arch. All right, now let's discuss the first pharyngeal arch first. This is a wedding scene, so there has to be music, right? Notice that we've shown this band member guy off to the left of the groom playing his trusty mandolin. The word mandolin sounds like mandible, which is here to help you remember the mandibular process and mandible. The mandibular process is a fetal structure that gives rise to many adult structures, which we'll talk about in the next few slides. Most obvious is the fact that the mandibular process gives rise to the mandible. The mandibular process also gives rise to a fetal structure known as Meckel's cartilage. To help you remember this, we've added a mechanical watch on this band member's wrist. The word mechanical sounds like Meckel and should help you think of Meckel's cartilage. Meckel's cartilage gives rise to the Malleus and the Incus. To help you remember the Malleus, we've shown a mallet hanging off of this guy's tool belt. I guess he uses this mallet to repair his instruments. We've also shown him wearing a shirt with an Inca symbol on it. Inca sounds like Incus. So putting all these ideas together should help you remember that the mandibular process gives rise to Meckel's cartilage, which ultimately becomes the Malleus and Incus. The last structure that the mandibular process gives rise to is the sphenomandibular ligament. To help you remember this, we've shown a sphinx cat next to the band member guy. So sphinx for sphenomandibular ligament. The other major cartilage derived from the first arch is the maxillary process. To help you remember this, we've shown another girl playing the xylophone with maxi pads. The word maxi in maxi pad sounds like maxillary process.
Did you make it full screen?
Okay. So far, are you guys understanding the?
Okay, that's not me right now. That's me in the past. Okay, but are you guys understanding the video? Yes or no? Okay, Dr. Asra Rahimi, what are you not understanding about this video? If you would just tell me very quickly so that I can help you.
Yeah, hi. Actually, the sound is not clear.
The sound is not clear. Okay, I'm going to try my best to clear the sound. If it's not as clear, maybe you can watch the video again, but I will explain everything. So don't worry, after the first pharyngeal arch ends, I will explain the video, and then I will move on to the second pharyngeal arch. Okay, so for now, you have a pharyngeal arch, the first one. This man over here who is standing with the mandible is the representation of the mandibular process from where you can get Malleus, incus, and stapes. This little baby over here with the maxillary, with the maxi pad, right? The maxi pad is a musical instrument. This maxillary pad can help you remember that this is the maxillary process that will give rise to the maxilla and the zygomatic bones. So try to understand from this. I know it's a little bit blurry. The sound may not be as clear, but if you, I will try to make, I'll try to make sure that you guys understand everything by the end of the video. Okay, so just have some patience and let's finish this. Okay, so
Actually, your sound in the past is clear,
right.
but the sound of the video, I
The
mean,
sound of the video is not clear. Okay.
yes.
Let's try one more time. Let me see if there's anything I can do to accentuate the sound, but I highly doubt there could be. Give me 1 second. Okay. Can you guys give this a try for 2 more minutes? Because this is the best I have right now. There's nothing going there. There's no other way I can accentuate the sound. Is it completely not understandable, or is it understandable to some extent?
It is understandable in some
Okay,
extent.
so please try to is it okay if I share the link for the original video? Do you have a link for the original video? Yes or no? Okay, so let me see if that works. Okay, Dr. Ita, we're waiting.
Yes, excuse me, sir. I sent it an email to you.
Okay. Let me see. Just give me 1 second. Just give me 1 second.
Welcome to section 8 of reproductive embryology. I'm not going to, apparently is a nice location for orbital sandstone arches, place at the formation. All right, with it.
Okay. Is it more clear now? Yes or no? Yes. Okay. Now can we begin? Yes or no? Oh.
With this in mind, let's dive into the image mnemonic. This scene will take place at the Arches National Park, which is a pretty cool place in the state of Utah that has tons of natural sandstone arches. We can see those arches very prominently in the background of this image. On the left, we can see one big arch, which apparently is a nice location for a wedding. This singular arch on the left will represent the first pharyngeal arch. On the right side of the image, we can see two arches right next to each other. So the information near these two arches will represent the second pharyngeal arch. All right, now let's discuss the first pharyngeal arch first. This is a wedding scene, so there has to be music, right? Notice that we've shown this band member guy off to the left of the groom playing his trusty mandolin. The word mandolin sounds like mandible, which is here to help you remember the mandibular process and mandible. The mandibular process is a fetal structure that gives rise to many adult structures, which we'll talk about in the next few slides. Most obvious is the fact that the mandibular process gives rise to the mandible. The mandibular process also gives rise to a fetal structure known as Meckel's cartilage. To help you remember this, we've added a mechanical watch on this band member's wrist. The word mechanical sounds like Meckel and should help you think of Meckel's cartilage. Meckel's cartilage gives rise to the Malleus and the Incus. To help you remember the Malleus, we've shown a mallet hanging off of this guy's tool belt. I guess he uses this mallet to repair his instruments. We've also shown him wearing a shirt with an Inca symbol on it. Inca sounds like Incus. So putting all these ideas together should help you remember that the mandibular process gives rise to Meckel's cartilage, which ultimately becomes the Malleus and Incus. The last structure that the mandibular process gives rise to is the sphenomandibular ligament. To help you remember this, we've shown a sphinx cat next to the band member guy. So sphinx for sphenomandibular ligament. The other major cartilage derived from the first arch is the maxillary process. To help you remember this, we've shown another girl playing the xylophone with maxi pads. The word maxi in maxi pad sounds like maxillary process, which should help you remember this structure. The maxillary process gives rise to the maxilla and the zygomatic bone. So the maxi pad represents the maxillary process as well as the maxilla, and the xylophone represents the zygomatic bone. So putting all of these ideas together should help you remember that the maxillary process gives rise to the maxilla and zygomatic bone. Now we've added some licorice on the edge of the xylophone that is accidentally getting knocked over as she plays her instrument. Let's zoom up a bit so you can see this better. In this image, we decided to include red licorice because it looks kind of like a blood vessel. Again, the maxi pad represents the maxilla. So the maxi pad hitting the bag of red licorice should make you think of the maxillary artery. If we zoom back out, we can see another band member taking a little rest on the chair. She also has a mandolin on her back, as well as 3 gems and a belt around her waist. The 3 gems should make you think of trigem, or the trigeminal nerve. And the fact that it's next to the mandolin should make you think of the mandibular branch of the trigeminal nerve. So putting all these ideas together should help you remember that the first pharyngeal arch is associated with the mandibular branch of the trigeminal nerve. All right, so far we've covered the cartilage, nerves, and arteries. Now let's move on to discuss the muscles of the first pharyngeal arch. Notice that we've added another band member and some dogs that belong to the bride and groom. If we zoom up on this, you can see that the dogs are enjoying a nice meal. The dog on the left is named Milo, as you can see by his name tag, and you can see him chewing pretty vigorously with some of his mastication muscles shown quite prominently. This reference to dogs eating and chewing should make you think of muscles of mastication. So the first arch gives rise to the muscles of mastication, such as the temporalis, masseter, and the lateral and medial pterygoids. We've also shown another band member playing the tympani, which should help you remember that the first arch also gives rise to the tensor tympani muscle. The fact that the dog's name is Milo should make you think of the mylohyoid muscle, which is another muscle associated with the first pharyngeal arch. Milo appears to have a doggy friend who's enjoying the food with him, and we can see his friend's tongue sticking out of his mouth. Notice that only the front part of the dog's tongue is visible, which should make you think of the anterior 2/3 of the tongue. So the first arch gives rise to the anterior 2/3 of the tongue. If we zoom back out now, you can see that we've shown the bride attempting to walk towards the arch, but she appears to be running into some trouble. This little kid was trying to hold her veil up to prevent it from getting dirty, but he got distracted and pulled a bit too hard. I guess you could say that there's a lot of tension on this veil. Anyway, tension and veil should make you think of the tensor veli palatini. So the first arch also gives rise to the tensor veli palatini muscle. Now we've shown an oblivious hiker guy trying to destroy some ants. He doesn't seem to care too much that a wedding is in session. He's more interested in pouring gasoline inside of this anthill. In any case, he has 2 cans of gas, one in each hand. This idea of 2 gas cans should make you think of dye gas. And the fact that he's pouring the gas on the anthill should make you think of the word anterior. So putting these 2 ideas together should help you remember that the first arch gives rise to the anterior belly of the digastric muscle. All right, now that we've covered the first arch, let's move on to discuss the second arch. As you may have seen from the table.
Okay, so did you guys understand the derivatives of the first pharyngeal arch? Yes or no? Okay. Very good. So are you guys ready to begin the second pharyngeal arch? Is everyone ready? Okay, so let's begin.
On the previous slide, many of the muscles associated with facial expression are derived from the second pharyngeal arch. To help you remember this, we've shown a group of school kids on an educational tour making faces at the people having the wedding. I guess they don't approve of this wedding disrupting their environmental excursion to the Arches National Park. So kids making faces for muscles of facial expression. This should also help you remember the facial nerve, which is cranial nerve 7. You may have also noticed that one of the schoolboys has decided to tie up a hammock between the 2 arches and is resting away peacefully. You can see him back here. This hammock that's tied between 2 arches is here to help you think of the number 2 and reinforce the idea that the information on the right side of the image is regarding the second pharyngeal arch. Now we've added one of the park workers that's responsible for cleaning up the park. We can see him diligently raking away in an attempt to make the area look nice and tidy. Anyway, the word rake should make you think of Reichert cartilage, which is an embryonic structure that gives rise to several structures that we'll discuss in a second. The first structure that is derived from Reichert's cartilage is the lesser horn of the hyoid. To help you remember this, we've shown a very small schoolboy playing the French horn and waving to the band as if saying hi to them. I guess he hopes to be like them one day, playing in a real band and all. His peers seem to think he's pretty ridiculous, so they're doing what school kids often do and are mocking him for his aspirations. In any case, the fact that this kid is so small should make you think of the word lesser, and the French horn should make you think of horn, so lesser horn. The fact that the boy is waving as if saying hi should make you think of the hyoid. So putting all these ideas together should help you remember that Reichert's cartilage gives rise to the lesser horn of the hyoid. All right, now we've shown several more students working on some projects around an outdoor table. Let's zoom up on them so you can see this better. First, notice that the kid in the middle is using a stapler. The word stapler sounds like stapes, which should help you remember that Reichert's cartilage gives rise to the stapes. It also should help you remember that the second pharyngeal arch gives rise to the stapedius muscle. We can also see a boy off to the right a bit using a stylus pen on an electronic device. The word stylus should make you think of the styloid process, which should help you remember that Reichert's cartilage gives rise to the styloid process. Finally, the kid off to the left is using a stylus pen and is also waving as if saying hi to some of the people at the wedding. The stylus pen should make you think of stylo, and the fact that he's saying hi should make you think of hyoid. So together, this kid should help you remember that Reichert's cartilage gives rise to the stylohyoid ligament. It's also here to help you remember that the second pharyngeal arch gives rise to the stylohyoid muscle. You may have noticed some red licorice right between the stapler and the kid saying hi. And this is to help you remember the stapedial artery and the hyoid artery. So the second pharyngeal arch gives rise to the stapedial and hyoid arteries. On the far right side of the image, we can see a very stuck-up kid who is sitting on the table and grimacing at the wedding. How dare they disrupt his peaceful outdoor time? To make him appear even more snobbish, we've shown him holding his pet platypus. Anyway, the word platypus sounds like platysma, which should help you remember that the second pharyngeal arch gives rise to the platysma muscle. If we zoom back out, we can see another worker guy pouring some gasoline on this post. I guess it's time for the post to go and install a new one, and he plans to remove the post by burning it down with all of his gasoline. Anyway, just like the guy with the gas off to the left, this guy is here to help you think of the digastric muscle. However, rather than an anthill, the post should make you think of the posterior belly of the digastric muscle. So the second pharyngeal arch gives rise to the posterior belly of the digastric muscle. All right, now that we've covered all of the structures associated with the first and second pharyngeal arches, let's move on to discuss some disorders. So there are 2 disorders associated with abnormal development of the first and second pharyngeal arches, including Treacher-Collins syndrome and Pierre-Robin sequence. Let's discuss Treacher-Collins syndrome first. Remember
Okay. So before I discuss the disorders, that is the 2 disorders. We have one that is Treacher-Collins syndrome. Another one that we have is Robin-Pierre sequence. So before we discuss this, let's discuss the pharyngeal arch derivatives of the first and second pharyngeal arch. Is everyone ready? Yes or no? Fast answers, please. Is everyone ready? Okay, good. So let's begin. The first pharyngeal arch is responsible for the development of cartilage, muscles, and nerves. From over here, this is your first pharyngeal arch, right? Over here, you have two types of process. What are the two processes for this guy over here? Very quickly, fast answers, please. This is the mandibular process. Very good. What is the process that is named for this one? This is for maxillary process. Yes or no? No. The mandibular process will give rise to what? The mandibular process will give rise to the mandible and the malleus incus and this stapes. Yes or no? Fast answers, please. Yes. The maxillary process over here will give rise to the maxillary bone and to the zygomatic bone. Yes or no? Fast answers, please. Okay. Now let's name the muscles. This little dog called Milo, who is chewing over here, is responsible for the muscles of mastication. Yes or no? The muscles of mastications are temporalis, masseter, lateral and medial pterygoids. Then you have this dog who is licking with the which portion of the tongue, anterior or the posterior? Very good. The answer is anterior two-third. Malleus and incus, very good. Not stapes, my apologies. Stapes is from the second. Malleus and incus only. This is from the anterior two-third of the tongue. Okay, now we have some muscles. This muscle over here is for tensor. This muscle over here with the guy beating the drums is for which one? For which muscle? This is for tensor tympani. This little boy pulling on the veil for which one? Fast answers, please. Pulling on the veil for which one? For tensor villi palatini. Yes or no? And then this guy over here is pouring gasoline on a bed of sand. This is for the anterior belly of the digastric. Yes or no? Anterior belly of the digastric. And what is the nerve that we have from the first pharyngeal arch? What is the name of the nerve? Is it the fifth or the seventh? The answer is this is the fifth trigeminal nerve, and especially which one? Maxillary, ophthalmic, maxillary, or the mandibular? The answer is mandibular branch of the trigeminal nerve. Okay, and now this is the second pharyngeal arch. For the second pharyngeal arch, you have this little child over here who is on a hammock in between these two, which represents the second pharyngeal arch. They're responsible for muscles of mastication or muscles of facial expression. Which one? Muscles of facial expression. What are the names of the muscles of facial expression? For the stylus pen, for stylohyoid. Then you have platysma, this boy with the platysmus called the platysma, and the posterior belly of the digastric muscle. Yes or no? The posterior belly of the digastric. And over here, what is the name of the nerve that is responsible for the second pharyngeal arch? The name of the nerve is seventh cranial nerve. Okay, so did we easily learn all the derivatives, cartilage, muscles, and nerves, and from the first and the second pharyngeal arch? Yes or no? Yes. Okay. Can anyone name which artery is responsible for the first pharyngeal arch? Which artery is responsible for the first pharyngeal arch? The artery that is responsible for the first pharyngeal arch is? Can anyone tell me which artery is responsible for the first pharyngeal arch? Maxillary artery. Very good. What is the artery that is responsible to be derived from the second pharyngeal arch? Second pharyngeal arch. Hyoidal or stapedial artery? Yes or no? Stapedial artery. Oh. Malleus and incus are derived from which pharyngeal arch? Fast answers, please. Malleus and incus from the first. Stapes is derived from which pharyngeal arch? Fast answers, please. From the second pharyngeal arch. Okay. Now, do we remember the muscles, cartilage, nerves, and arteries? The answer is yes. Are we ready to learn the two diseases, how to remember their signs and symptoms? Okay, so let's begin.
The information on the left is regarding the first pharyngeal arch, and the information on the right next to the two arches is regarding the second pharyngeal arch. Therefore, the information directly in the middle of the image is true of both the first and second pharyngeal arches. So in this image, we'll include both disorders in the center region of the image. All right, with this in mind, notice that we've added a teacher of all these hooligans in the center of the image. As you can see, she's teaching them about dominoes and xylophones. Anyway, the teacher should make you think of Treacher-Collins syndrome. And like I just mentioned, she's in the middle of the image, so Treacher-Collins syndrome is caused by derangement of the first and second pharyngeal arches. She's teaching these kids about entertainment, and we can see her using a laser pointer to highlight some of the dominoes on her poster. We've used this symbol in some of our biochemistry videos, but for those of you who have not watched these yet, just know that the dominoes represent autosomal dominant diseases, because dominoes sounds like dominant. So Treacher-Collins syndrome is an autosomal dominant disorder. The xylophone should make you think of zygomatic bone and help you remember that in this disorder, there is zygomatic bone hypoplasia. Also notice that we intentionally made the teacher standing on top of the crest of a little hill. This crest should make you think of neural crest and help you remember that this disorder is associated with neural crest cell dysfunction. Now we've added this hippie band guy to the image. He was playing in the wedding band, and when he had a break, he stepped away to ask this music teacher for some advice on how to play his mandolin. You can see that after climbing up the hill, he's out of breath. And this should help you remember that Treacher-Collins syndrome is associated with airway compromise. The mandolin that he's holding is here to help you remember that this disorder is also associated with mandibular hypoplasia. Finally, notice that the teacher is holding her hand up to her ear as if she can't hear him very well. After all, he's out of breath, so I guess this makes sense, right? In any case, the reference to difficulty hearing should help you remember that this syndrome is associated with hearing loss. Here is a picture of a patient with Treacher-Collins syndrome, which highlights some of the characteristic facial features. So to summarize, Treacher-Collins syndrome is caused by derangement of the first and second pharyngeal arches. It's an autosomal dominant disorder associated with neural crest cell dysfunction and presents with facial abnormalities, such as mandibular and zygomatic bone hypoplasia, as well as airway compromise and hearing loss. All right, now let's move on to discuss Pierre-Robin sequence. To help you remember this disorder, we've shown a bunch of robin birds in the middle of the image. Robin birds, Pierre-Robin sequence. Again, just like with Treacher-Collins syndrome, we've shown this between the information representing the first pharyngeal arch and the second pharyngeal arch to help you remember that Pierre-Robin sequence is caused by derangements of the first and second pharyngeal arches. Most birds, including robins, have pretty small beaks, which should make you think of a small face or jaw. So Pierre-Robin sequence is associated with micrognathia, or small jaw. Now we've added two more birds to the image. If we zoom up, we can see that they got a hold of some of the bride's lip gloss and are now trying to eat it. The word gloss should make you think of glossoptosis, which refers to downward displacement of the tongue. So Pierre-Robin sequence is associated with glossoptosis. Also notice that we've shown the robins on a wooden pallet that's a bit worn down from the harsh environment. Anyway, this broken down pallet should make you think of a cleft palate. So Pierre-Robin sequence is associated with cleft palate. Finally, notice that we've added one of the groomsmen over near the birds. He was innocently admiring the birds when he began to have an allergic reaction. I guess he's deathly allergic to robins and now he can't breathe. Anyway, the fact that he's holding his throat as if he's having an allergic reaction should help you remember that Pierre-Robin sequence is associated with airway obstruction. Here's a picture of a patient with Pierre-Robin sequence, which highlights some of the characteristic facial features. So to summarize, Pierre-Robin sequence is caused by derangement of the first and second pharyngeal arches. It presents with micrognathia, cleft palate, glossoptosis, and airway obstruction. All right, that should be everything you need to know about the first.
Okay.
Okay, so can we have one physician who can unmute himself or herself and tell me the signs, symptoms, and the clinical features of these two diseases? Okay, so Dr. Jorge Otero, thank you so much. Please unmute yourself.
Yes, hello, doctor. Good morning.
Good morning.
Yes,
Okay,
we
so
have
first,
to
let's talk about the Crutcher-Collins disease first.
Okay, excellent. It's produced.
First of
by-
all, Crutcher-Collins is an abnormality of the first and the second pharyngeal arch together. Is it autosomal dominant or is it autosomal recessive? The answer is it is autosomal dominant. Very good. Okay. And we can remember this from the dominoes over here. Okay. Now, please tell me the clinical features of Crutcher-Collins.
Okay, first of all, we're going to have facial abnormalities.
Okay.
Are the zygomatic bone hypoplasia and also mandibular hypoplasia. We're going to have also hearing loss.
Hearing loss, as you can see, this teacher, right? And which is a neuroplastic dysfunction. And this guy over here represents which clinical feature?
Oh, air compression.
Airway compromise. Very good. Thank you so much.
Compromise.
Okay. Thank you so much, Dr. Otero, for helping us out. Who can describe Pierre-Robin sequence very quickly? Please say yes or me in the chat box. Dr. Alam, thank you so much. Please unmute yourself.
Hello, everyone. This
Yes.
is also the second, first and second pharyngeal arch.
Okay.
The fact is what cleft plate.
Cleft palate.
Yeah, a small chain, macroglossia, and airway obstruction.
Macroglossia is not a thing. Glossoptosis.
Yeah,
Glossoptosis.
glossoptosis.
Glossoptosis, airway obstruction, cleft palate. Okay. And
Yeah.
another
A
one
small
is
chain,
micrognathia. Micrognathia. Okay, very good. So now a couple of quick questions and a quick answers before we move on to the third and the fourth pharyngeal arch. So thank you, Dr. Otero and Dr. Alam, for helping us out. Very quickly, mandibular nerve from which pharyngeal arch? Fast answers, please. Mandibular nerve from which pharyngeal arch? Very good. Stylohyoid muscle from which pharyngeal arch? Stylohyoid muscle from which pharyngeal arch? Second. Malleus and incus from which pharyngeal arch? Right. Fast answers, please. Stapes from which pharyngeal arch? Muscles of mastication, tensor tympani, tensor villi palatini, anterior belly of digastric. Very good. Muscles of facial expression, and posterior belly of digastric, platysma. Okay. Airway compromise, hearing loss, autosomal dominant disease. What is the name of the disease? Autosomal dominant, hearing loss, airway compromise. Treacher Collins, micrognathia, glossoptosis. Very good. Pierre Robin sequence. Okay. So can we say that we have successfully understood the derivatives of the first and the second pharyngeal arch? Quickly, yes or no? Yes. Okay, good. Next one is this better? Is this a good way for learning? Yes or no? Instead of me telling you to memorize this for no reason? Yes. Okay, good. Now, the artery for the first pharyngeal arch is which artery? Fast answers, please. The artery for the first pharyngeal arch is maxillary artery. The artery for the second pharyngeal arch is which artery? Stapedial artery. Okay. Are we ready to begin the third and the fourth pharyngeal arch? Third and the fourth pharyngeal arch derivative? Yes or no? Okay, so let's begin. Let me know if you guys have any problems.
Reproductive embryology. In this section, we'll be discussing the third, fourth, and has associated couch that has some off to the left take place. Just like with the last video, this scene will also take place near the Arches National Park. Notice that off to the left of the image, we've included a cabin with a couch that has some head cushions shaped like the number 3. This is here to help you remember the third pharyngeal arch. All the information off to the left by this cabin will be about the third pharyngeal arch. Towards the middle of the image, we've added a 4-square play area. The 4-square is here to help you think of the number 4. So this part of the image will be all about the fourth pharyngeal arch. Finally, off to the right, we've added some adults sitting on the dirt and enjoying a few 6-packs. The 6-pack should make you think of the number 6 and is here to help you remember that this part of the image is all about the 6th pharyngeal arch. Hopefully with the way we've compartmentalized this information, it'll make it easier to recall the details. All right, now that we've laid out the framework for the image, let's discuss the third pharyngeal arch in more detail. In the last video, we showed a very small kid with a French horn who was waving and saying hi, and this represented the lesser horn of the hyoid. In this video, we'll use a similar symbol, but notice that this kid is pretty chubby. So he represents the greater horn of the hyoid. So chubby kid waving as if saying hi, and French horn for greater horn of the hyoid. As the story progresses, you'll eventually see who this friendly chubby kid is waving at. Now we've added the kid's dad to the scene. If we zoom up, you can see that his dad is enjoying some food and swallowing some pretty big bites. Looks like he must have swallowed a chicken drum whole, and we can see the bone in his throat, which is sticking out pretty prominently. This reference to swallowing should help you remember that the third pharyngeal arch is associated with the muscle and nerve associated with swallowing. Zooming out a bit more, you can see that we've added a forensic guy along with his canine dog to the scene. There must have been some suspicious activity taking place in these parts, so there appears to be an ongoing investigation. The dad and kid don't seem to care too much though, just sitting back and enjoying the couch. Anyway, the word forensic sounds kind of like pharyngeus in the word stylopharyngeus. So this is here to help you remember the stylopharyngeus muscle. The 9 in canine should make you think of the 9th cranial nerve, which is the glossopharyngeal nerve. So remember, the third pharyngeal arch is associated with the muscle and nerve related to swallowing, including the stylopharyngeus muscle and the glossopharyngeal nerve. All right, if we zoom out a bit more, now we can see why there is an ongoing investigation. Someone died right on the porch. We can see a forensic guy palpating the unfortunate soul's carotid artery to see if he has a pulse, but it appears to be hopeless. This reference to the carotid arteries should help you remember that the third pharyngeal arch gives rise to the common carotid artery and proximal part of the internal carotid artery. The last thing you need to know about the third pharyngeal arch is that it forms the posterior 1/3 of the tongue. However, the third pharyngeal arch isn't the only contributor. The fourth arch also contributes. So notice that we've placed the symbol for this concept right in between the cabin on the left and the foursquare area in the middle. So this dog and the pharyngeal guy right here. If we zoom up a bit, you can see that the pharyngeal guy is holding the front part of the dog's tongue with his hand, which effectively obscures it from our view. Now we can only see the posterior aspect of the dog's tongue. This is allowing him to adequately swab the back of the dog's mouth. I guess they want to be sure that the dog isn't responsible for the death, right? Anyway, putting all of these ideas together should help you remember that the third and fourth pharyngeal arches form the posterior 1/3 of the tongue. All right, so far we've covered all the information about the third pharyngeal arch. Now let's transition and discuss the fourth pharyngeal arch. Again.
Okay, so before we move on to the fourth pharyngeal arch, from the third pharyngeal arch, what are the names of the two muscles? Or the one muscle, my apologies. What is the name of the muscle? The name of the muscle is? Is the name of the muscle stylopharyngeus? The answer is yes. Very good. Okay. Very good. Next one is, what is the name of the cartilage? Is it the lesser horn of the hyoid bone or the greater horn of the hyoid bone? Greater horn of the hyoid bone. What is the name of the nerve for the third pharyngeal arch? The name of the nerve? K9 for glossopharyngeal 9, cranial nerve. Okay. What is the name of the artery for the third pharyngeal arch? The name of the artery is, which artery? Carotid. Which carotid? Right common carotid. Okay, very good. Next one is the anterior 2/3 of the tongue is developed from which arch? Fast answers, please. The anterior 2/3 of the tongue from the first. The posterior 1/3 is developed from which arch? Fast answers, please. Posterior 1/3 from the third and the fourth. Okay. Are we clear? Yes or no? Can we begin with the fourth? Okay. So let's begin with the fourth pharyngeal arch and the sixth pharyngeal arch. Okay. So these fourth and sixth pharyngeal arch, they are not very important. Try to remember the nerves and the arteries, and that's that mostly. The cartilages are a bit difficult to remember, and they are not heavily tested in your step 1 exam. If you can remember them, that's very good. If you cannot remember them, then that's not a problem. Okay, let's begin.
And the information near the foursquare area represents the fourth pharyngeal arch. As you can see, we've added a bully to the image. He lost the game of foursquare and is a sore loser, so now he's trying to strangle his opponent near the foursquare area. Luckily, a parent is supervising these rambunctious hooligans and is stopping the bully. Anyway, the bully squeezing the other kid's throat is here to help you think of pharyngeal constriction. So the fourth pharyngeal arch forms most of the pharyngeal constrictor muscles. The poor kid getting strangled is pretty traumatized, and we can see him bawling his eyes out. The word cry sounds like crico, and the fact that his neck is being strangled should make you think of the word thyroid, because this is where the thyroid gland sits, right? Anyways, putting these two ideas together should help you remember that the fourth pharyngeal arch forms the cricothyroid muscle. Finally, the parent is lifting up this bully by his shirt, causing it to cover his head. This kind of resembles a veil and should make you think of the word veli. The fact that he's getting elevated into the air by the parent should make you think of levator. So putting these ideas together should help you remember that the fourth pharyngeal arch forms the levator veli palatini muscle. All right, now we've added two more components to the image. First, notice the guy off to the right here. He was apparently hired by these adults as a form of entertainment. He brought a record player and is playing some nice tunes for them. His business is known as Vegas Records, and he brought some shirts that say Vegas on them to try and sell to the adults. Now take a look near the foursquare area. Notice that we've shown a kid getting suspended in the air by his friend. They stole one of the DJ's shirts and are running around showing all of their friends. In any case, the word Vegas should make you think of the vagus nerve. Also, the reference to the kid being high up in the air should make you think of the word superior. So putting these two ideas together should help you remember that the fourth pharyngeal arch is associated with the superior laryngeal branch of the vagus nerve. Now let's discuss the vasculature associated with the fourth pharyngeal arch. You can see that now we've shown a tree growing behind the foursquare area. If you look closely, you can see that it resembles the aortic arch. We've also intentionally placed it a bit off to the left to make you think of the left aspect of the fourth pharyngeal arch. So putting these ideas together should help you remember that the left aspect of the fourth pharyngeal arch forms the aortic arch. The right aspect, on the other hand, forms the proximal part of the right subclavian artery. To help you remember this, we've shown a kid off to the right of the tree eating a sub sandwich. So sub for subclavian artery.
Also notice that we've shown his friend trying to hand him some red licorice, which kind of resembles blood vessels. This is here to help reinforce the idea that we're dealing with the vasculature associated with the fourth arch. Okay, we've covered all the muscles, nerves, and arteries of the fourth pharyngeal arch. Now let's discuss the cartilage. Notice that these are shared between the fourth and sixth arches. Just like how the dog was between the area that represents the third arch and the fourth arch right here, notice that we've included several more elements to the scene, and they are directly between the foursquare area and the adults with their six packs right here. So all of this information will be about both the fourth and sixth pharyngeal arches. Let's zoom up on this so you can see it better. First, notice that one of the kids was trying to play foursquare when his ball accidentally landed on a nearby kid who was enjoying a bowl of cornflakes. The ball knocked over the bowl and then bounced back and hit him right in the neck. The cornflakes are here to help you remember the corniculate cartilage. He was pretty excited to eat the cornflakes, and now that they have spilled all over his lap, he's pretty upset. Look at those tears. Anyways, the crying is here to help you remember the cricoid cartilage. Don't get this confused with the other kid right here who's crying. Remember, he was being strangled and simultaneously crying. The reference to the neck plus crying with this kid was here to help you think of cry and thyroid, so cricothyroid. On the other hand, this kid crying without his throat being strangled should just make you think of the cricoid cartilage. So the fourth and sixth pharyngeal arches form the cricoid cartilage. Next, notice that the ball is hitting the other kid directly in the throat where the thyroid gland is. This is to help you remember the thyroid cartilage. A bit below this tragic scene, we can see another bully terrorizing an innocent kid that's minding his own business and trying to study. We can see the bully mindlessly ripping up his homework. The word rip sounds like arytenoid, and it's here to help you remember that the fourth and sixth pharyngeal arches form the arytenoid cartilages. Finally, the Q&A quiz that the other kid is working on sounds kind of like cuneiform. Q&A, cuneiform. So the fourth and sixth arches also form the cuneiform cartilage. All right, that's all for the fourth pharyngeal arch. Let's finish up by discussing the remaining portions of the sixth pharyngeal arch. As you can see, now we've added some speaking pop-up bubbles around these adults. After all, they're having a pretty good time listening to music, drinking their six packs, and talking to each other. Seems kind of like social hour for them. Anyway, these speaking pop-up bubbles and the reference to social hour should help you remember that the muscles and nerve associated with the sixth pharyngeal arch assist with speaking. We introduced the DJ guy earlier with his record player, and the word record should make you think of recurrent. This, along with the vagus reference, should help you remember the recurrent laryngeal nerve, which is a branch of the vagus nerve. Now we've added a guy who's enjoying the conversations and simultaneously feeding some wild ducks licorice. Just like before, the licorice is a reference to the vasculature. This, along with the ducts, should make you think of the ductus arteriosus. So the sixth pharyngeal arch gives rise to the ductus arteriosus. Now we've added a fourth guy to the scene who is also enjoying some licorice until he noticed some wild bobcats coming out of their lair directly towards them. Now we can see him coughing up his licorice in terror and pointing towards the bobcats in an attempt to warn his friends. Rightfully so, because remember the forensic investigation from earlier? Well, I think we just found the culprit to this murder. You guessed it, the bobcats are responsible. Anyway, the cough should make you think of the lungs, and the licorice should make you think of the lung vasculature. So putting these two ideas together should help you remember that the sixth pharyngeal arch gives rise to the proximal part of the pulmonary arteries. The bobcat's lair is here to help you think of the word larynx. And remember that the sixth arch forms all of the intrinsic muscles of the larynx except the cricothyroid, which is derived from the fourth pharyngeal arch, like we discussed earlier. All right, now that we've covered all the information, let's review with a question. A medical student is being tested on the...
Okay. So let's talk about the fourth and the sixth pharyngeal arch. Is everyone ready? Yes or no? No. The fourth arch is responsible for which nerve? Fast answers, please. The fourth arch is responsible for which nerve? 10th, which one, superior or the recurrent laryngeal branch? Which one? Superior. The sixth nerve is responsible for which part, superior or the recurrent? The answer is recurrent. Very good. The fourth arch, which artery is responsible for the fourth arch? Fast answers, please. The artery for the fourth arch. Aortic. Very good. The artery for the sixth arch. Proximal pulmonary artery. For the sixth arch is proximal pulmonary artery. Okay. Can anyone name all the cartilages, just in case if they have put their attention, if they remember? Can anyone name all the cartilages from the picture? All the cartilages from the picture, can anyone name? Yes, Dr. Odotero, can you name the cartilages? Yes or no?
Yes,
No.
Doctor.
Okay.
From the you said from the fourth and sixth, right?
Yes, from the fourth and the sixth.
Okay, we have in order? Can it
No,
be-
not in order. Just name the cartilages.
Okay. We have the cuneate, the
Okay.
cricoid, but it
Cricoid.
will be separate because it's formed the cricoid cartilage from the sixth, and the cricothyroid cartilage from the fourth,
Okay.
and arytenoid cartilage.
Okay.
It will be fourth and sixth,
Okay.
and then cuneiform cartilage fourth and sixth.
Okay. And thyroid?
The thyroid it will be the fourth, just the fourth. That's the exception.
Very good. Okay. Next one is, can we ask Dr. VK to unmute herself very quickly, Dr. VK?
Yes, doctor.
Yes. What is the nerve that we have from the fourth pharyngeal arch? Fast answers, please.
It's a cranial nerve 10.
Which one? Superior, recurrent, which one?
Superior laryngeal branch.
Sixth arch. What was the name of the nerve?
It's a recurrent inferior laryngeal.
Recurrent laryngeal. Next one is, what are the names of the cartilages from the fourth and the sixth?
Fourth, it's thyroid.
Okay.
The sixth is cricoid, arytenoid, cuneiform, and corniculate.
Okay. What is the name of the artery from the fourth?
Fourth is aortic, and then sixth is a proximal part of pulmonary artery.
Okay. Thank you so much.
Thank you, doctor.
Okay. Now,
Okay, so now we are done with the pharyngeal arches. So very quickly, while this page loads up, let's just do a quick revision of the pharyngeal arches over here. Okay, let's do a quick revision of the pharyngeal arches. Now, very quickly, from the first pharyngeal arch, what is the name of the nerve? Fast answers, please. The name of the nerve, V3. Seventh cranial nerve is from which arch? Ninth cranial nerve is from which arch? Superior laryngeal nerve is from which arch? Recurrent laryngeal nerve is from which arch? Maxillary artery is from which arch? Right, number one. Stapedial artery is from which arch? Number two. Aortic arch is from which pharyngeal arches? Fourth. Proximal pulmonary artery is from which pharyngeal arches? No. Very good. Ricard's cartilage is from which arch? Ricard cartilage. Two. Very good. Greater horn of the hyoid is from which arch? Three. Very good. Arytenoid, corniculate, cuneiform, thyroid are from which arch? 4 and 6. Okay. Maxillary process and mandibular process is from which arch? Okay. So these are your pharyngeal arch derivatives, which we have learned effectively from the physio. Please remember this. Please remember the video. And let's move forward to the pharyngeal pouches. Pharyngeal pouch. Okay. Now, the pharyngeal pouch, the derivatives of the pharyngeal pouch, they're actually very easy to remember. From the pharyngeal pouch, you have the endoderm, right? So you have the first, second, third, fourth. You do not have a sixth pharyngeal pouch. The first pharyngeal pouch is responsible for middle ear cavity, eustachian tube, and the mastoid air cells. Very easily. You guys remember from where do we have the external auditory meatus? Fast answer, please. The external auditory meatus is from where? External auditory meatus is from where? First, what? Arch or cleft? First, cleft. Okay, good. And then from the first pouch, we have the middle ear cavity. Okay. The second pharyngeal pouch. The second pharyngeal pouch is responsible for epithelial lining of the palatine tonsil, of the tonsils. Okay. The third pharyngeal pouch has 2 wings, and the fourth pharyngeal pouch has 2 wings. The third pharyngeal pouch, you have the dorsal wing and the ventral wing. The fourth pharyngeal pouch, you also have a dorsal wing, and you also have a ventral wing. The third pharyngeal pouch dorsal wing will give rise to the inferior parathyroid, and the fourth pharyngeal pouch dorsal wing will give rise to the superior parathyroid. So what's happening? Why do we have the inferior above in the third and the superior parathyroid? As you can see, parathyroid has a superior and the inferior. The inferior is coming from the third pharyngeal pouch. The superior is coming from the fourth pharyngeal pouch. What happens is during development, you have an inversion. The fourth pharyngeal pouch goes upwards and the third pharyngeal pouch goes downwards. That's how in an adult, anatomically, you have the superior parathyroid above and the inferior parathyroid below, because you have this sort of an inversive movement over here in between the pouches. So the dorsal wings of the fourth pharyngeal pouch move up, and the dorsal wings of the third pharyngeal pouch, they move down. That's that. The ventral wing of the third pharyngeal pouch is responsible for the thymus, and the fourth pharyngeal pouch ventral wing is responsible for the parafollicular cells, the ultimo pharyngeal body. Okay, I'm going to give you guys 2 minutes to learn this information over here, first, second, third, fourth. After that, I'll move on to orofacial clefts. Okay, so 2 minutes on the clock. Please learn this, and then I'll move forward. Okay, is everyone ready? Yes or no? The first pharyngeal pouch. Who can tell me the derivatives of the first pharyngeal pouch? Fast answers, please. We do not have a lot of time. Dr. Alam, thank you so much. Very quickly, tell me the derivatives of the first pharyngeal pouch.
External auditory meatus, mastoid ear, and
Not the external, the middle ear cavity.
yeah, sorry, Eustachian tube.
Eustachian tube, middle ear cavity, and the mastoid
Mastoid
thank
ear.
thank you so much. Who can tell me the derivatives of the second pharyngeal pouch very quickly? We do not have a lot of time. Second pharyngeal pouch. Dr. Sana, please unmute yourself.
Epithelial lining of the palatine tonsils.
Okay, thank you so much. Who can tell me the derivatives of the third pharyngeal pouch? Dorsal wing, ventral wing. Dr. Itar, thank you so much.
The dorsal wings give the inferior parathyroid, and the ventral wings give the thymus.
Okay, who can tell me the derivatives of the fourth pharyngeal pouch? Fast answers, please. Fourth pharyngeal pouch. Dr. Hagar, thank you so much.
Hello, everyone. The dorsal wing for the superior parathyroid give rise to superior parathyroid, And
Okay.
the ventral wing gives rise to the parasthyroid C-cell follicles.
Okay, very good. Thank you so much. Okay. So that's that. So that's all we have, the cleft, arches, and pouches. Okay, so now let's begin our discussion of the orofacial clefts. Is everyone ready? Yes or no? Is everyone ready? Orofacial clefts? Okay. So let's talk about orofacial clefts. Now, the orofacial clefts, we have cleft lip and cleft palate. Now, cleft lip and cleft palate are the diseases. So let's talk about the pathology in 1 second. Before that, let's talk about the physiology or the embryology of the development. Okay. Now, as you can see over here, you have a couple of prominence. So this is basically the picture of what's happening over here. So if you were to visualize like this is your eyes, then you would see what's happening over here, okay? So what's happening over here is that you have the frontonasal prominence, you have the medial nasal prominence, and you have the lateral nasal prominence. Now, cleft lip, so what happens is that all of these prominences, they attach together, right? They join together to complete your facial structure, the external and the internal features of your facial structure. The cleft lip is a disease that happens when you have failure of fusion of the maxillary process and the medial nasal process. So this is the medial nasal process. This medial nasal process, it combines with the maxillary process. This is one maxillary process. This is another maxillary process. So these three things will combine together to complete your lip. And when you have a cleft in your lip, meaning that you have a space in between your lip, this is a very favorite USMLE step 1 question. The answer is failure of fusion of the maxillary process and the medial nasal process. Why do we have cleft palate? Cleft palate is failure of fusion of the two lateral palatine shelves. Over here inside, you have shelves called lateral palatine shelves. So they sort of come together. You have one palatine shelf like this. You have another palatine shelf like this. Both of them, they come together and they complete your palate. If there is any sort of abnormality in their fusion, then you have a cleft palate. Okay, so that's it. Failure of fusion of the lateral palatine shelves with the nasal septum, as simple as that. So these two are very favorite USMLE step 1 questions. You need to remember which ones are responsible for what type of a cleft. Cleft lip is due to imbalance between maxillary process and medial nasal process. Cleft palate is due to incomplete fusion between the two lateral palatine shelves and the nasal septum, as simple as that. So that's all about the cleft lip and the cleft palate. Let's move down to genital embryology. Is everyone ready? Yes or no? Is everyone ready? Okay, good. Now, how many of us are aware that a developing embryo before sexual differentiation into a male or a female is by default always a female? How many of us are aware of this? That the developing embryo, before they are differentiated sexually, the default structure is a female structure, right? Yes. So the first ever embryological structure is the female. So basically, at all points of our human development, every one of us, before we received the Sry gene, were we all females? Yes or no? Fast answers, please. The answer is yes. Okay, as simple as that. So females are always the default development. Okay, males are made of females. Yes, that's very correct. Males are actually made from females, as simple as that. So the developing embryo is always a female. Now, it's based on the fact that whether this embryo receives a Y gene or not. Okay, if they receive the Y gene, then there's a very, if they receive the Y chromosome, my apologies. If they receive the Y chromosome, right? In the Y chromosome, there's a very specific region of the Y chromosome. That region is known as SRY. Okay, I like to call this sorry. That It's the Sry gene. That's sorry, you are not going to be a female anymore. Now you're going to be a male. Okay, so the Sry gene. So SRY gene on the Y chromosome, this produces testis determining factor. So this is for testis development. So whenever we have the SRY gene, what happens is under the influence of the SRY gene, males and females both have these cells called Sertoli cells and Leydig cells. Under the influence of the SRY gene, the Sertoli cells secretes MIF, and the Leydig cells, they secrete testosterone, right? If the SRY genes were not there, then the Sertoli cells would not secrete MIF. Now, since this is a developing male we're talking about, once they receive the Y chromosome, the Sry gene on the Y chromosome will stimulate the Sertoli cells to secrete Mullerian inhibiting factor. Mullerian inhibiting factor will involute the Mullerian duct. Okay, so we have two ducts. We have the mesonephric duct, and then we have the paramesonephric duct, right? The mesonephric duct and the paramesonephric duct. So over here, so as you can see, this is the mesonephros, this is the paramesonephric duct, and then this is the mesonephric duct. Under the influence of the testis determining factor based on the Sry gene on the Y chromosome, if we do have this, then what happens is that the mesonephric duct, as you can see, that there is involution of the development of the paramesonephric duct. The paramesonephric duct is responsible for giving rise to the female reproductive organs. The mesonephric duct is responsible for giving rise to the male reproductive organs. And if Mullerian inhibiting factor is released from the Sertoli cells under the influence of the Sry gene on Y chromosome, we have involution of the paramesonephric duct, so they involute, and the mesonephric duct remains. As you can see, this is the mesonephric duct, right? And the paramesonephric duct that involutes later stays as a remnant. We call this appendix testis. I'll talk about this in the future. Okay, so that's it. Now, what if the developing embryo did not receive the Y chromosome, if they only had two X chromosomes, then do they have the Mullerian inhibiting factor? The answer is no. So will they develop as males or females? The answer is they will develop as the default structure, that is female. So they develop into the female internal structures, that is the mesonephric duct. The mesonephric duct will give rise to the fallopian tube, uterus, the upper portions of the vagina, right? And we have another disease over here. This is known as Mayer-Rokitansky Coasterhauser syndrome. Mayer-Rokitansky Coasterhauser syndrome is a disease where we have Mullerian agenesis. This may present as primary amenorrhea due to lack of uterine development. So what happens is over here in Mullerian agenesis, which is Mayer-Rokitansky Coasterhauser syndrome, this is a disease where you have abnormal development of the mesonephric duct. So you do not have a developing uterus, but the female secondary sexual characteristics over here are present. Why? Because over here, you do not have a developing uterus, but you do have the gonads, the ovaries, right? The ovaries are responsible for the secretion of estrogen and progesterones and all of those things. So these hormones will make sure that the female has a secondary sexual characteristic, but they will not have a uterus. If you ask me why, then this is a developmental disorder of the mesonephric duct, as simple as that. Okay, so the mesonephric duct, also known as the Wolffian duct, will develop into the my apologies. This is due to an abnormality of the paramesonephric duct. I always mix it up. Mesonephric duct is for the males, paramesonephric duct is for the females. So once again, why do we have Mullerian agenesis? This may present as secondary amenorrhea due to lack of uterine development, due to abnormal development of the mesonephric or the paramesonephric. Fast answers, please. Because of the paramesonephric duct. Okay, good, very good. Now let's talk about the mesonephric duct. This is the Wolffian duct. Wolffian means wolf. Okay, wolf has hair. Male or female, who has more hair? The answer is males have more hair. That's why this duct is known as the male duct or the Wolffian duct. Okay, this develops into the male internal structures. These are the 4 structures that are developed from the mesonephric duct. These are called seed. Seed for seminal vesicle, epididymis, ejaculatory duct, and vas deferens, ductus deferens. You need to remember this. The female remnant is known as Gardner's duct. Okay, this is the female remnant of the paramesonephric duct. This is known as Gardner's duct. So a couple of quick questions very quickly. The default development, is this a male or a female? Are we all born as males or are we all born as females? The answer is we're born as females. Then based on which chromosome, X chromosome or the Y chromosome, do we get male features? Y chromosome. What is the name of the gene? The name of the gene is SRY gene. Under the influence of SRY gene, the Sertoli cells will secrete which hormone? MIF. The Leydig cells will secrete what? Estrogen or testosterone under the influence of SRY gene? Testosterone. Very good. Now, the gonads will develop into testes or ovaries? Testes. Very good. Which duct will persist? Mesonephric or Wolffian duct or paramesonephric duct? Mesonephric duct. Very good. Okay. Next one is, what are the structures that are developed from the mesonephric duct? 4 structures: seminal vesicles, epididymis, ejaculatory duct, and vas deferens. Yes or no? Fast answers, please. The answer is yes. Okay. Next one is paramesonephric duct. Paramesonephric duct. If there's any abnormality of the paramesonephric duct, do we have Mullerian agenesis or Mayer-Rokitansky Coasterhauser syndrome? Yes or no? Okay. Why is it called Mayer-Rokitansky Coasterhauser? Because the scientist or the pathologist who discovered this disease, her name was Mayer-Rokitansky Coasterhauser. Are we clear? Yes or no? Okay. Okay, good. Very good. Now let's talk about sexual differentiation very quickly. So we have talked about this, that how based on the presence of the Y chromosome, the gonads will develop into testes, and based on the absence of Y chromosome, the gonads will develop into ovaries. Once you have the testes, then you have the Leydig cells and the Sertoli cells. The Sertoli cells will secrete MIF. MIF will cause involution of the Mullerian duct or the paramesonephric duct, and they will cause the mesonephric duct to persist. The mesonephric duct will give rise to the internal male organs, and the testosterone that is secreted will convert a couple of things. For example, in the females, do we have a structure called the clitoris? Yes or no? Fast answers, please. The answer is yes. Okay, so under the influence of testosterone, clitoris will turn into the penis. In females, do we have the labia majora and the labia minora? Yes or no? The answer is yes. Under the influence of testosterone, the labia majora and the minora will turn into what? Can anyone tell me? They will turn into the scrotum. Okay, they will turn into the scrotum. And then under the influence of testosterone, you will have the proper development of the prostate, right? The prostate, which is responsible for putting nutrients and substances in the semen, right? So penis, scrotum, and prostate, they are not under the influence of mesonephric duct. That is very important. Mesonephric duct is only responsible for seed. Seed stands for seminal vesicle, ejaculatory duct, epididymis, and duct deferens. Dihydroxytestosterone is responsible for penis, scrotum, and prostate. As simple as that. Okay. And if you do not have the Sry gene from the Y chromosome, then the MIF will not be secreted, right? What will happen is that the mesonephric duct will get obliterated. The ovaries, they will stimulate by secreting estrogen that will convert the external genitalia. Over here, you have 3 parts of the external genitalia: clitoris, labia, and the distal vagina. And the internal female genitalia, that is the fallopian tube, the uterus, and the proximal vagina, they are all developed from the paramesonephric duct. Okay, are we clear? Yes or no? Based on the presence of estrogen or testosterone, or how much they are secreted, we will have the onset of puberty, right? What is puberty? Puberty is the development of the secondary sexual characteristics based on the secretion of the male or the female hormones. If there's a female puberty, then we have 2 stages, right? Number 1 is called menarche, onset of menstruation, then telarche, that is breast development, and pubarche, that is the development of the pubic and the axillary hair. In males, do you have telarche in males? Yes or no? The answer is no. Do you have pubarche in males? Yes or no? The answer is yes. Males also develop pubarche, that is axillary and pubic hair, and increase in size of the secondary sex organ, right? And that's basically that. You get facial hair, vocal cord gets more thick, and there is muscular development, all because of the presence of testosterone. Okay. Okay, very quickly, I just want to talk about this. Males and females, do they have different voices? Yes or no? Males have a more deep bass and a low pitch. Females have low bass and a high pitch. Can anyone tell me why? Can anyone tell me why? Why do males have commonly higher bass, lower pitch? Females have lower bass and higher pitch. Like, let me tell you why. Do you know how we speak, guys? Do we speak from the lungs? Yes or no? Do we speak from the lungs? Yes or no? Do you guys know how we speak? Okay. So this is the airway tract. In the airway tract, is this the vocal cord, the glottis? Yes or no? The answer is yes. So we take air in, and when we give air out, if we want to speak, while we are speaking, is air coming out of our mouth? Yes or no? The answer is yes, right? While we are speaking, air comes out of our mouth. So air, when it comes out of our mouth, this is the voice box, the larynx, which consists of the glottis. In males, or in females, we have the voice because the glottis, every time air comes out, the glottis contracts. Yes or no? So based on the contractions of the glottic muscles, the air, when it passes through this creates a sound. And when we move our face, when we move our jaws and our tongues, we create certain sounds, right? We create certain words, certain noise, and everything else. In males, the glottis, based on testosterone, is very thick. It's a very thick glottis. If it was a female, the glottis would have been very, very thin, very thin. So air, when it passes through a thick glottis, will it create a much more deeper voice? Yes or no? The answer is yes. In females, the glottis is very thin. So will it create a much more high-pitched voice in females? Yes or no? The answer is yes. Okay. Why am I talking about this? I'm talking about this that in females, if they abuse steroids from outside, external exogenous steroids for bodybuilding, for female bodybuilders, in those cases, can females have very deep voice? Yes or no? The answer is yes. Okay. Always remember this. This is a step 1 question. Internal overproduction of testosterone. Can it happen in females? Yes or no? The answer is internal overproduction of testosterone. Can it happen in females or not? Yes or no? The answer is yes. If there is a Leydig cell tumor, if there is anything else, then females can also have testosterone or PCOS. But do females with PCOS and all of those things, do they have deep voice? Yes or no? The answer is yes or no. The answer is yes or no. The answer is no. Always remember this. Internal production of testosterone in females will not produce deep voice. Females, if they have deep voice, that means that these females are abusing steroids from outside, because steroids, exogenous steroids in females, are the only way they can have deepening of their voice. Are we clear? Yes or no? Yeah, the answer is yes. Okay, that's that. So that's basically what it is. Okay, absence of Sertoli cells or lack of Mullerian inhibiting factor will develop both male and female internal genital organs. So that makes sense. So for example, let's say if the SRY gene is there, but the MIF is not secreted because the Sertoli cells are not functioning. In that case, will the paramesonephric duct obliterate? Yes or no? Last answers, please. The answer is, will the paramesonephric duct obliterate if we do not have MIF secretion from the Sertoli cells? Yes or no? The answer is no. In that case, will we have persistence of both mesonephric and paramesonephric duct? The answer is yes. In that case, can we have both male and female genital organs? Yes or no? Last answers, please. The answer is yes. Okay, so that's that. Next one is 5-alpha reductase deficiency. If we have 5-alpha reductase deficiency, will testosterone be converted to dihydroxytestosterone, the more active form? The answer is no. In that case, can we have male internal genitalia, but ambiguous external genitalia? Yes or no? The answer is yes. Okay, that's simple. So in the testis, leading leads to male, certainly shuts down female. This is not important. Let's move down to over here. Okay. Mullerian anomalies. Mullerian anomalies are abnormalities of the paramesonephric duct. So paramesonephric duct usually forms the fallopian tubes, the uterus, and the proximal part of the vagina, right? This is the normal structure. If there is any abnormalities, because we have two paramesonephric duct, 1, 2. This one will convert. Okay. You have a question, Dr. Sana. What question do you have? Fast, please ask me the question fast so that I can move forward.
Yeah, Dr. Hedri, how come if there's absence of the Sertoli cells or lack of Mullerian inhibitory factor, we have both male and female internal genitalia? How? I mean, one has to obliterate, right? And
no, one does not
has
have to
persist.
obliterate. No. One does not have to obliterate. This is the normal development. Okay, Dr. Sana, do you, are you still here with me? Yes or no? Okay. Just say yes. Just say yes or no. Is this the normal embryological genital structure? Yes or no? Fast answers, please.
Yes.
Yes. Okay. So based on the Mullerian inhibiting factor, one will obliterate and one will remain. Yes or no? Fast answers, please.
Yes. Yeah.
Okay. If we do not have Mullerian inhibiting factor, then what happens? Then the mesonephric duct will persist. If the mesonephric
so
duct,
it is like in females,
yes.
right?
Yes. It's not really male or female. It's basically both. So let's say someone have an XY, but the Y chromosome of that male is producing SRY gene, but that SRY gene is not being able to differentiate this structure, this gonad, to secrete Mullerian inhibiting factor. In that case, Mullerian inhibiting factor will not be secreted, so the paramesonephric duct will persist and the mesonephric duct will persist. As a result, these people will have both female and male genital organs. Are we clear? Yes or no?
Dr. Hedri, what happens when there's a female, right? If there's no SRY, then both of them will persist.
No. What happens is that if we do not have SRY gene, you have the estrogen secretion from the undifferentiated gonads. That estrogen causes the development of the Mullerian duct, and the mesonephric duct does not develop at all. That's why in females, the mesonephric duct persists as a remnant. Okay? Are we clear?
Okay.
Yes or no?
I got
because
it. Yeah.
If the SRY gene is not being able to produce testosterone, the ovaries are secreting estrogen, which will convert Mullerian duct to the female internal structure. And over here, what will happen is that the mesonephric duct will also persist. In that case, the mesonephric duct, since SRY gene is not there, the mesonephric duct will, since the SRY gene is not there, the paramesonephric duct will develop and the mesonephric duct will convert into the internal male structure. But there's a question. The question is that will we have complete development of the external male genital organ? The answer is no. That's why in these people, we call them ambiguous genitalia. Ambiguous means we do not know what genital organ this is. This could be male, this could be female. Are we clear? Yes or no? Okay.
Yeah, difficult, but yes.
Okay. Let's move forward. So now we were talking about paramesonephric duct development. The paramesonephric duct is responsible for the development of the female internal structures. They have the fallopian tubes, the uterus, and the proximal vagina. We have two paramesonephric duct, 1, 2. Both of them have to fuse together. Yes or no? Fast answers, please, guys. Both of them have to fuse together to form this structure. The answer is yes. If there is an abnormality of fusion, can we get these pathologies? Yes or no? The answer is yes. So this is the number one pathology, that is septate uterus. This is incomplete. So what happens is after both of them, they fuse. After they fuse like this and they form the uterus and the vagina and the fallopian tubes, there's a septa over here. This septa in a normal developing female will obliterate. They will disappear. If it does not disappear, the septa remains over here. This septa causes a septate uterus. That is, the uterus cavity gets divided into two cavities over here. This is very common, and these patients, they usually come to you with sign symptoms of recurrent abortion. Okay, recurrent abortion. And so when we do a contrast, imaging of the uterus, we see something like this, and we can easily treat them by getting rid of the septa. We can do a we can do a septoplasty. Septoplasty means getting rid of the septum so that the uterus can convert from this to this. Have we understood septate uterus? Yes or no? The answer is yes. Next one is, let's say that the paramesonephric duct, they cannot fuse at all. If they fail to fuse, can we have bicornuate uterus? Yes or no? With completely two different cavities? The answer is yes. Okay. Next one is Uterus Didelphis. This is in complete failure of fusion. That is, you have two uterine cavities, one, two, one from one mesonephric, another from another mesonephric. Now, the question is, can we have pregnancy possible in uterine didelphis? Yes or no? The answer is yes. Can we have pregnancy possible in bicornuate uterus? Yes or no? The answer is no. Can we have pregnancy possible in septate uterus? The answer is maybe. Maybe. I'm not really sure about this, but which one is more common, septate, bicornuate, or didelphis? The answer is septate is more common. Okay. Are we clear? Yes or no? Okay, good. Now, let's talk about the derivatives. Is everyone ready? Yes or no? Let's talk about the derivatives. Okay. Okay. Now, so let's talk about a disease. Let's talk about a story. Is everyone ready? Yes or no? Okay. Do you guys want to take a short break before we talk about this one? You guys want to take a short break before we talk about this? Okay. So let's take a short break before we talk about the male and the female genital homologs. After that, from our break, we'll come back, we'll finish embryology, and then we'll jump into reproductive anatomy. Okay. So let's take a break for 15 minutes because I think the break is very important right now because we have to remember this, specifically memorize this. So I'll tell you a story about this so that you can easily remember, and then we'll start anatomy. Okay. So I'll see you guys in 15 minutes. It's 11:57. I'll see you guys at 12:15 p.m. Okay. Thank you so much. Okay, is everyone back from the break? Can you guys hear my voice? Yes or no? Okay, is everyone else back? Dr. Itar is back. Who else is back from their break? You can hear my voice. Okay, good. So let's begin. So over here, you have, can anyone tell me what this is very quickly? Okay. One second. Very quickly, what is this? This is the Aladdin's what? Magic lamp. And what happens when you rub the lamp? What comes out when you rub the lamp? What comes out? A genie comes out. Okay. Okay. So for this picture, right? So for this picture, this genie is responsible for giving males a gift and females a gift. So for males, you have male genie. For females, you have female genie. Okay. Now, over here, the male and the female, you have the male genie, they will give a gift to the males. The number one gift that they will give to the male is a sponge. Okay. They will give them a gift of a sponge. This is a sponge. Then they will give them a gift of a cave. Okay. They will give them a gift of a sponge, and then they will give them a gift of a cave. Okay. And they will give them another thing. That is, they will give them coins or coins or money in the form of pennies. Okay. Did we understand, yes or no, the three gifts that they will give to the males? Fast answers, please. Okay. To the females, they will give them what is this? This is a light, or can we call them bulbs? Yes or no? Bulb. Very good. And they will also give females this thing over here. This is also pennies. Okay. They will give them coins in the form of pennies. Okay. Okay. So can we use this information to remember that Genie stands for Genital Tubercle? Yes or no? In males, they will give them 3 gifts: corpus spongiosum, corpus cavernosum, and penis for penis. In females, they will give them the vestibular bulb and clitoris. You know, like how the clitoris was supposed to be the penis, but it's not. So penis in both cases. So in one case for males, it's the penis, and it's the penis. For females, you have the clitoris. Okay. Are we clear, guys? Yes or no? Okay. Okay, good. Again. Okay, now how many of us over here speaks Urdu by any chance? Does anyone over here who speaks Urdu or Hindi? Yes. What do we call flying in Urdu or in Hindi? Flying. What do we call the word flying? Urna, right? Or ur means flying, right? Very, very good. So over here, let's say that this is a flying genie. Okay, how do you draw a flying genie? Let's I'm just going to draw a blue character over here, right? Who is flying. So this is a flying genie. Flying genie. Okay. So this flying genie will now give the males and the females some more gifts. Okay. What are the gifts that this flying genie will give to the males and to the females? So to the males, this time, this flying genie will give them a bulb, and this thing over here. This is that they will give them something like this. They will give them, let's say, a mat. Okay. A prayer mat. Okay. They will give them a prayer mat. Prayer mat and a bulb to the males. To the females, they will give them and another mat. The thing is that the mat that they will give to the females, this mat can fly. So this is a flying mat. Okay. And they will also give them and another thing. That is, they will give them this structure over here. This toy is the toy of, let me tell you what this is the toy of. Okay. Give me 1 second. Can anyone tell me which cartoon character does this look like? Very good. Simpson. Which Simpson? Is this Homer Simpson or is this Bart Simpson? Which Simpson is this? The son. Very good. The name of the son is? Bart. Yes or no? Past answers, please. Okay. Okay. Good. So this flying genie is the fact that flying in Urdu or in Hindi stands for Ur or okay, Euro or Urna or Urno. This stands for flying, and Genie for Euro for flying, and Genie for urogenital. Urogenital sinus. Urogenital sinus in males, they will give them a bulb. Bulb stands for bulbourethral gland. And this prayer mat, what do we do in the prayer mat? Do we prostrate down and do we bend and do we fall on our head? Yes or no? To pray to our gods and deities? Yes, yes or no? The answer is yes. So prayer mat for prostrate. So with this, you can remember prostate gland, as simple as that. In females, they will give them a toy that is Bart Simpson's for Bartholin gland, and a flying mat for, again, Euro, flying for Euro. So this is urethral and para-urethral gland. Are we clear? Yes or no? Urethral and para-urethral gland. Are we clear, guys? Yes or no? Okay, next one. Next one is we have a genie like this. This is the head of the genie. This is the hands of the genie. These are the legs of the genie. Can we say that this is a folded genie? Yes or no? Okay. The folded genie will give males a gift. This gift is called, this is a shaft. Okay. They will give them a shaft like a stick. In females, they will give them a minor shaft. Okay. So with this, can we remember that this folded genie is urogenital fold? Urogenital fold. In males, they will give them a shaft. Shaft for the ventral shaft of the penis. For a minor shaft for the females, can we use this? Remember that this is for labia minora. Okay, are we clear? Yes or no? Yes, okay, good. The last one, I do not want to use any more diagrams because this is very easy to remember. The last one is a labioscrotal swelling. Labioscrotal swelling. I think we all know that labioscrotal swelling is responsible for giving males scrotum, and for females, they give them labia majora. Okay, so one more time, let me revise the picture mnemonic over here. So you have a flying genie. Flying genie stands for, I mean, you have a genie that's coming out of the lamp. This is for genital tubercle. The genie that initially comes out of the lamp gives the male 3 gifts: a sponge, a cave, and penis. So sponge for corpus spongiosum, cave for corpus cavernosum, and penis for penis. In females, they give them the number 1 gift, that is a bulb, that is for vestibular bulb. And once again, they give them penis. So penis in females for clitoris. Okay. Next one is a flying genie. Flying stands for Uro in Urdu, that is for urogenital. So flying genie for urogenie. So the urogenie will give the males a bulb, that is the bulbourethral gland, and a prayer mat for prostration. So prostate gland. In females, they will give them a toy, that is Bart for Bartholin gland, and a flying mat for urethral and para-urethral glands of skin. This is a folded genie. The folded genie will give the male a shaft, and in females, they will give them a minor shaft for the ventral shaft of penis and for labia minora. Then the last one is labioscrotal swelling that will form the scrotum, and in females, they will form the labia majora. Okay, I'm going to give you guys 2 minutes to remember this. After that, I'll move forward. Okay, so 2 minutes. After that, I'll ask you questions and then I'll move forward. If how important do you think this is? Is this very important or not important? The answer is this is very, very important. Since this is very, very important, that's why I took so much time to draw diagrams so that the students can easily remember all of the derivatives. Okay, so that's that. I'm going to give you guys 2 minutes. Please remember this information. After that, I'll move forward to the next page. Okay, is anyone done? Yes or no? Dr. Hagar. Who else is done? Who else is done? Dr. Itar, who else? Okay. So let's ask the first question to Dr. Hagar. Thank you so much. Please unmute yourself. What are the male derivatives of genital tubercle?
Yes, doctor, we remember the Genie who give the male the sponge, the cape, and penile, which is the corpus spongiosum, corpus cavernosum, and the glans penis.
Very
And
good.
he gives the
females?
female, he gives the female the pulp and the penile, which is the penile for the clitoris and the
Okay.
pulp for the vestibular pulp.
Thank you so much. Next one is Dr. Itar. You have a flying genie, which stands for what?
Urogenital sinus.
Very good. In males, what will they derive?
He will give the pulpourethral gland and the prostate.
Mhm.
In females,
Females?
the vestibular gland, the Bartholin gland, and the urethral and paraurethral glands.
Okay, good. And that's that. Thank you so much, Dr. Itar. Next question is for Dr. Alam. What do we mean by the folded genie?
Urogenital fold.
Okay, in males, they will give what?
Shaft.
Shaft stands for which one?
It was
For the
minor
ventral
shaft was
shaft of
labius
ventral shaft of penis. Okay, and the minor shafts stand for what?
labia minorum.
Thank you so much. Next student. The next student is Dr. Sana. Dr. Sana, would you be kind enough to tell me labioscrotal fold, labioscrotal swelling will give rise to what?
Yes, in males it gives rise to scrotum, and in females it gives rise to labia majora.
Thank you so much. So can we use this to remember all of this information? Yes or no? Yes. Okay. Quick questions and quick answers. Bartholin's gland is derived from where? Fast answers, please. Bartholin's gland is derived from where? Okay, good. Bartholin's gland is derived from urogenital sinus. Very good. Corpus cavernosum and corpus spongiosum. Where are they derived from? Genital tubercle. Very good. Okay. Labia minora is derived from where? Very good. Scrotum is derived from where? Labioscrotal swelling. Okay. Okay, good. Very good. Just give me 1 second. So sometimes you guys can even get a picture of this. Okay. So if you get a picture like this, over here, this structure of the developing gonads, this is the genital tubercle. Okay. This in the middle, this is the urogenital fold, right? And over here, let me show you the urogenital sinus. Okay. One second. The urogenital sinus is actually difficult to visualize. They do not give you questions for the urogenital sinus, but let's see. Okay. Urogenital sinus picture is not important. Please focus on the genital tubercle and the urogenital folds. Okay. Are we clear, guys? Yes or no? Last chances, please. Are we clear? Okay. Now let's talk about some congenital penile abnormalities. Congenital penile abnormalities are very, very important for your step 1 exam. Congenital penile abnormalities are basically you have two high yield diseases. Number one is hypospadias, number one is epispadias. It's very easy to understand what hypospadias is and what epispadias is. First of all, penile abnormalities are when we have failure of fusion. So it's an abnormal opening of the penile urethra where the urethral folds, they fail to fuse. So the normal penis should have a urethra straight like this where it will drain to the external penile meatus. But in majority of the cases, when they fail to fuse, the penile urethra, they open at the bottom of the shaft of the penis. When they open at the bottom of the shaft of the penis, we call this disease hypospadias. Hypospadias happens due to failure of urethral folds to fuse. Please underline this line. And epispadias is when the penile shaft has the urethral opening on the upper portion. Okay, abnormal opening on the dorsal or the top surface. So well, that's that. So it's very easy to understand what hypospadias is and what epispadias is. So in your question, if they tell you that you have penile leakage of young children, pediatric population, below the shaft of the penis, what is the disease? The disease is hypospadias. If they tell you that the penile opening is on the top of the shaft of the penis, what is the name of the disease? This is epispadias. Hypospadias, what is the pathology? Failure of fusion of urethral fold. Epispadias, what is the pathology? Faulty positioning of the genital tubercle. So what is the disease and what is the pathology? Please underline this. Okay. Another thing is that with epispadias, you also have another disease called bladder exostrophy. That is, the bladder is outside. The bladder is visualized outside of the body. Okay. This is called bladder exostrophy. The bladder can be visualized outside. This is called bladder exostrophy. The bladder exostrophy is associated with epispadias. You need to remember this. Are we clear? Yes or no? Everyone? Yes. Okay. So what is the disease? Hypospadias. Why do we have the disease? Due to failure of the urethral folds to fuse. What is the disease? Epispadias. Why do we have the disease? Faulty positioning of the genital tubercle. What is the association of epispadias? Exostrophy. What is the association of hypospadias? Inguinal hernia, cryptorchidism. Very, very high yield. These are the step 1 questions. Okay. Next one. Descent of testis and descent of ovaries. So you know how testis and ovaries, they descend. So in a baby, in a developing human, you have the testis that's in the abdomen or that's in the scrotum. Fast answers, please. Initially, the testis, they stay in the abdomen, right? So they stay in the abdomen over here like this. And this is the scrotum where they will eventually come. So the scrotum is associated, the base of the scrotum is attached with a fibrous tissue that is attached to these two testes. And based on the contraction of this fibrous tissue, they contract downwards, and this moves the testis from the abdomen through the inguinal canal to the scrotum. If you have something that's wrong with this fibrous tissue, will the testis stay in the abdomen? The answer is yes. Okay, do we call this cryptorchidism? The answer is yes. These people, are they at chance of developing testicular carcinoma? The answer is yes. Okay, So what is the name of this fibrous tissue? The name of this fibrous tissue is called gubernaculum testis. Okay, it is anchored the testis within the scrotum. Another one is processus vaginalis. Processus vaginalis is a fold of peritoneum. So the peritoneum fold like this. They fold, they come down, and they fold like this. This is called processus vaginalis. They form the tunica vaginalis that is responsible. If they are patent for a long period of time, we can have hydrocele. Hydrocele are bag of fluid in the scrotum. They are bag of fluid. They're transillumination wise, they're positive. Okay, and we have to do a surgery to get rid of this fluid. Why do this fluid accumulate in the scrotum? Because of patency of the tunica of the processus vaginalis. If the processus vaginalis, if they're patent, then fluids from the abdomen can come and get accumulated in this fold of peritoneum, and this can give rise to swelling of the testis with accumulation of fluid known as hydrocele. As simple as that. Are we clear? Yes or no? Fast answers, please. Yes. Okay. Good. Okay. Very good. Okay. So do you guys want to start anatomy today, or do you guys want to start anatomy fresh from Monday and do questions now? Let me get some feedback from the students. Fast answers, please. Let me get some feedback from the students. Anatomy today or anatomy next week? Monday. Okay. So let's start anatomy from Monday. Let's do some Usmle step 1 questions. So today, since we have time, I just want to do 10 biostatistics questions and 10 reproductive questions. Okay. So first we will start with the reproductive questions, then we will start with biostatistic questions. Okay, very quickly, how much time do we get for each question? Fast answers, please. How much time do we get for each question? 90 seconds. Okay. Let's just do all the questions, no problem. Is everyone ready? Yes or no? No. So these 10 questions that we will do, they will be questions from embryology, anatomy, physiology, pathology, and pharmacology. So we will discuss these 10 questions, then we will move on to biostatistics questions. Okay. If you come across a question which we have not studied as of yet, please try to see if you can make the correct answer from your previous knowledge. Or if you want to skip out on the answer and just choose one at randomly, you're more than welcome to do so. I will discuss each and every question after the 15 minutes are over, and then I'll move on to biostatistics. Okay. Does everyone have a pen and a paper ready? Yes or no? So best of luck. Let's begin. Okay. Can everyone hear my voice? Yes or no? Your time is up. Can everyone hear my voice? Yes or no? Your time is up. Okay. Let's begin. Let's talk about the first one. Okay. Very quickly, I need the help of 5 physicians. 5 physicians. Please voluntarily say me or yes on the chat box to help me out. 1, 2, who else? 3, 4, another one. 5. Done. Okay, thank you so much. First one is Dr. Hagar. Please unmute yourself very quickly and read the question.
Yes. Which of the following is the most likely the cause of this patient symptoms? A previously healthy 20-year man came to the physician because of 6 months history of painless mass in his left groin that has been gradually increasing in size. Physical examination shows 3 by 3 centimeter oval, non-tender, left inguinal mass, and a fluctuant, painless left scrotal swelling that increase in size.
Okay. So as a
came-
matter of fact, nothing is important over here except this description. 3 by
Yes,
3
yes.
oval, non-tender, inguinal mass, painless, swelling. Okay, painless, fluctuant, and inguinal mass.
Yes,
Which
and
one of this is the correct answer for this? And
It's
especially if it's a
F.
painless and mass, then this is a
F, I guess. It's hernia.
this is
It's
not
an
a
inguinal
hernia.
hernia.
This is not an inguinal hernia. Hernias are not painless. Hernias, they are not painless. Hernias are not fluctuant. I'm surprised everyone chose the wrong
Yeah,
answer.
it's not fluctuant. That's right.
Okay,
But
so
it is painless unless there is a strangulation. or something.
incarceration or strangulation, right? Okay, good. So
Yes.
does this make this diagnosis, this description, does it sound like a hernia to you? Yes or no?
No. Right
It's
now
not
it's
a
in my
hernia.
mind.
Okay, so it's
Yeah.
painless and fluctuant, so it's not a hernia. So what else? What are the possible diagnoses? This could be an abscess, but abscesses are painful. This could be the testis, but the male's age is 20 years. By now, the testis would come down. This could be some sort of a benign tumor or a carcinoma, but tumors are not fluctuant. This could be a
Yes.
hydrocele, yes or no?
Yes.
Can this be a hydrocele? Okay, so which
Yes.
one of this is for hydrocele?
It's
A, B, C, D.
the first one, failure of process vaginalis to close. Yes.
Very good. Okay. Are we? Is everyone clear? Yes or no? Okay. Doctor, who was the physician who was helping me out right now? Dr. Hagar. Yes. Yes. Dr. Hagar, please
Yes.
read question number 2.
Okay. Which of the following is the most appropriate initial action by this physician?
Okay.
A previously healthy 29-year-old woman come to the physician because of 3-day history of low-grade fever, muscle ache, and rash.
Okay.
She has 4 male sexual partner over the past year and uses condoms inconsistently.
Inconsistently. Okay, this is very
Yes.
important. Next one.
Yes. An examination shows diffuse maculopapular red that include the palm and soles. Testing for non-specific anti-cardiolipin antibodies is positive.
What is the diagnosis of this patient? It's very easy.
Yes,
Anti-cardiolipin
syphilis,
antibodies
yeah.
are positive. Syphilis. So which one do we do for this one?
This one is non-specific, so they want a specific one.
Very good.
I will choose
Specific
this.
testis?
Yes. What? The fluorescent for treponemin antibody, I guess. Yes.
Very good. Yes, very good. Dr. Hagar, you could perfectly dissect the question. You are completely aware that over here, they already did the non-specific test. So now you need to do the specific test. D is for non-specific, E is for specific. So everyone who chose D, it's wrong because dark field microscopy, if it's positive, you do not know if it's syphilis. Dark field microscopy positivity represents 3 organisms. One is Borrelia, another one is Leptospira, another one is syphilis. So dark field microscopy will not give you the specific answer. Okay, third one. Third one is by who will help me out after Dr. Hagar. The next physician was Otero, Dr. Otero.
Yes, doctor. A 45-year-old man undergoes elective vasectomy for permanent contraception. The procedure is performed under local anesthesia. There are no intraoperative complications, and he is discharged home with ibuprofen for postoperative pain. The patient should be advised about an increased risk for which of the following conditions over the next 3 months?
Okay, Dr. Otero, were you talking? Yes or no? Yeah, I think you were, and I apologize, but I was not talking. I had a very important phone call. Would you be kind enough to help me out one more time, if you do not mind?
Yes, doctor.
Thank you so much. Okay, I apologize. There was a phone call. Okay, please read the last line.
Okay. The last line is the patient should be advised about an increased risk for which of the following conditions over the next 3 months.
Okay. Now, please read the question.
Yes, doctor.
Read the question.
Oh, the case again. Okay, a 45-year-old man undergoes elective vasectomy for permanent contraception. The procedure is performed under local anesthesia. There are no
Okay.
complications.
This is very easy, very easy, very easy. Okay, so which one did you choose?
A.
A. How many of us agree with A? The answer is A. Very good. This is a very easy question, right? Usually what happens, the entire procedure is a very small procedure, but the patients need to stay away from getting involved in sexual intercourse, or at least having unbarrier mode of sexual intercourse for 3 months after vasectomy, because for the first 3 months after vasectomy, there is still a high possibility of semen ejaculation. So you will advise your patients, if you perform vasectomies, you have to advise your patients in order to avoid unplanned pregnancy and to avoid having ejaculation of semen from the seminal vesicles, they need to have a barrier contraception. Okay, for the first 3 months. Next one. Dr. Otero, one more time, if you want to help us out, please. Read
Yes.
the last line of the question.
Correct. A 28-year-old man comes to the physician because of a 2-week history of testicular swelling and dull lower abdominal discomfort. Physical examination shows a firm, non-tender left testicular nodule.
Mhm.
Ultrasonography of the scrotum shows a well-defined hypoechoic lesion of the left testicle. Serum studies show an elevated beta HCG concentration and a normal alpha fetoprotein concentration. The patient undergoes a radical inguinal.
Okay, I think this is enough. I think this is enough for me and for you to understand that this is a diagnosis of what. Dr. Oda, would you be kind enough? This patient has a what problem? This is a?
No.
What is the problem? What is the disease? Is this a testicular tumor? Yes or no?
Yes, correct.
Okay, good. Thank you so much. Further evaluation. So testicular tumors will go to which lymph node? Fast answers, please. Hey, everyone. It's para-aortic lymph node, right? Para-aortic lymph node. I think we all know this. Do you remember we talked about this? Where did we talk about lymph nodes? Did we talk about lymph nodes yet? I don't think we talked about lymph nodes. Okay, no problem. We'll talk about them in rheumatology, I guess. Next one is who else helped me out? One was Marty help me out. Dr. Ethar, would you be kind enough to help me out? Please
Yes.
unmute yourself and read the question.
Which of the following changes is most likely to occur in this patient's condition?
Okay.
An year-old man come to the physician because of fatigue, difficulty falling asleep, and night sweats for 6 months. Menstrual cycles were regular, and her last menstrual period 2 months ago. She quit smoking 2 years ago. Vulvovaginal atrophy, pregnancy test negative.
Okay, you know what this patient is suffering from, yes or no? This patient has early onset of menopause, yes or no? In menopause, we have increase of which hormone? Last chances, please. Of what?
Follicular stimulating hormone.
Very good. Okay, good job. Next question. Please read this question, Dr. Rita.
Okay, which of the following is the most likely cause of this finding? 8-year-old girl presented by her parents concerned about their daughter's growth. She's showing signs of puberty earlier than her older siblings. She's turning 9 next month. No history of any medical condition. She's 96 percentile for height and weight. Vital signs normal. Tanner stage 1 for pubic hair and development. Tanner stage 2 genital development. Axillary soft hair. I think this girl is developing normally.
Very good. How and why do you know this girl is developing normally?
Her Tanner stages are not that quite advanced.
Very good. The tanner stage is not advanced. That's number one. Number two, pubarchy and pelarchy and adrenarchy. Does it go with her age? Yes or no?
Yes. Yes.
Okay. The only thing that's a bit worrisome is the weight and the height. Yes or no?
Yes.
They're the 96%. So this is called early onset of puberty because this girl has entered the pubertal growth at an early period. But if she had intracranial tumor era or some sort of a tumor, will she have more exaggerated clinical features? Yes or no? The answer is yes. So this is normal development. Okay, very good. Let's move forward to another physician. Thank you so much, Dr. Gita. Another physician was Dr. VK, who said yes for helping us out. Please unmute yourself and read the question.
Yes, doctor. Which of the following condition is most likely to occur as a result of tamoxifen therapy?
Easy question.
A 57-year-old woman comes to the physician for evaluation of a lump in the right breast that she first noticed a week ago. Biopsy of the mass confirms a diagnosis of pleomorphic lobular carcinoma in situ, that is estrogen receptor positive.
Perfect.
The patient
Okay. Which one of this is the clinical features? Yes, the patient undergoes lumpectomy and treatment with tamoxifen is initiated. Tamoxifen is a selective estrogen receptor modulator, meaning that it acts selectively to antagonize the estrogen receptor in the breast, but it acts as an estrogen agonist in the uterus. So this makes which answer the correct answer?
A, endometrial cancer.
Very good. Next one, number 8, Dr. VK. Would you be kind enough?
This cancer is most likely derived from which of the following types of cells?
Okay.
A 35-year-old woman comes to the physician because of a 2-month history of vaginal bleeding after intercourse. Menarche occurred at the age of 13 years and menses occur at regular 28-day intervals. Gynecological examination shows an irregular lesion of the cervical os. Histological evaluation of a cervical biopsy specimen obtained on colonoscopy confirms, colposcopy.
Not colonoscopy. This is
colposcopy confirms a diagnosis of in situ cervical cancer.
True. Next.
The answer is non-keratinized stratified squamous epithelium. The answer is C.
Absolutely wonderful. That is the correct answer. Okay. Because non-keratinized stratified squamous epithelium is the epithelial lining of cervix. Thank you so much.
Squamous junction.
Okay, next one. Yes, that is squamous junction. Very good. Okay, now next one. Who was another physician who said they'll help me out? Dr. Alam. Please unmute yourself and read the question.
A loss of integrity of which of the following ligament is most likely involved in this patient's condition?
Okay.
A 36-year-old lady comes to the physician for a 2-month history of urinary incontinence and vaginal mass.
Okay.
She has a history of 5 full-term normal vaginal deliveries. She gave birth to a healthy newborn 2 months ago. Since then, she has felt the sensation of vaginal fullness and a firm mass in the lower vagina. She has loss of urine when she coughs and sneezes or exercises. And pelvic examination shows an irregular pink globular mass protruding out of the vagina.
Okay, so this is a pelvic organ prolapse. Pelvic organ prolapse usually happens due to laxity of which ligament? The answer for this one is they happen due to the laxity of not infundibulopelvic. Infundibulopelvic is another name for the yes, very good. The correct answer for this one is uterosacral ligament. Okay, uterosacral ligament. This is something we'll talk about on Monday, anatomy. So we'll talk about the ligaments since you guys did not know this. If we have an infundibulopelvic ligamental problem, we will have ovarian cessation of blood flow. Yes or no? What is the name of that pathology where we have ovarian cessation of blood flow? This is called ovarian torsion. Are we clear? Yes or no? Torsion. Okay. Dr. Alam, please read the last question.
The patient is at increased risk for which of the following adverse effects? An otherwise healthy 26-year-old man comes to the physician for medication counseling after recently being diagnosed with schizophrenia. Risperidone is initiated.
Okay, very easy question.
Yeah.
Risperidone will cause what?
Gynecomastia.
Very good. How did you know this? We talked about this, right? Risperidone is an atypical antipsychotic that will disrupt the D2. As a result, we will get increased release of prolactin, because if dopamine is decreased, then prolactin is increased. We talked about this, right? So
Yeah.
high prolactinemia will cause release of, it will inhibit GnRH secretion that will stimulate decreased production of FSH and LH. Testosterone will decrease, estrogen will increase, and as a result, they will get gynecomastia.
And I also ruled out the other options like agranulocytosis for
Right.
clonazepine and
Very
weight
good.
loss. It
Not
causes weight gain.
not clonazepine, clozapine.
Clozapine, yeah.
Clozapine. Okay, very good. So I'm glad that you are aware of all the drugs that are responsible
you.
for all the side effects. Granulocytosis, very good, was for clozapine. Short QT interval is something that we also see in risperidone, but over here, this is not high yield. Hypothyroidism is something that we can expect in patients who have lithium, and weight loss is also another thing. But over here for gynecomastia, risperidone is the correct answer. Okay, so thank you so much. So I think you guys did pretty well. Now, are we ready to do some biostatistics questions, or do you want to keep biostatistics questions for Monday? Which one? Fast answers, please. Some feedbacks, high yield feedbacks. Today, let's do. Let's begin. Is everyone ready with the pen and the paper? Yes or no? Okay. We did 51 to 60. Today, let's do 61 to 66. Wait 1 second. Did we do 45? Yes or no? No. So we will do 45, 46, 47, 48, 49, 50, and 61 to 66. Okay. Is everyone ready? Yes or no? Okay. So let's begin. I'm going to mute myself and we will do this. Okay. Best of luck. Let's begin. Okay, is everyone ready? Yes or no? Last answer, please. We only have 5 students. Okay, so what happened to the other students? What happened to who else was here? Okay. I didn't even realize that they left. Okay. So for all the students who left the class without letting me know, you guys are missing out on biostatistics. Okay, and for all the students who have stayed back, the diligent student, the good students who wants to do good in their exam, let's do this. Are you guys ready? Yes or no? Fast answers, please. Okay, so 5 students. Each of you guys will help me out. So number 1, Dr. Ethar, help me out, please, very quickly. Unmute yourself. Read the question. Fast answers, please. Fast answers. Dr. Ethar, are you there? Yes.
Yes, I'm here.
Okay, read the question.
Okay, one of the computed measures of central tendency is 8 point. Okay, which of the following characteristic is generally true about these measures? Investigators studying the association between exclusive breastfeeding and body weight in infants. The body weight of 15 infants at the age of 6 months were measured. Results are shown. One of the computed measure of central tendency is 6.8.
Okay.
Which of the following characteristics is generally true about this measure? Okay.
Okay, so which one of the following characteristics is generally true about this measurement? One of the computed measures of central tendency is 6.8. 6.8, 6.8. How many 6.8 do we have? 1, 2,
2 times,
and 2 times, right? Do we have anything else that's 2 times? No. So can we say 6.8 is the mode? Yes or no?
Yes. The most
because it's the most common number. Okay, it's the most common number. Now, this is the question about mode. It is the 50th percentile of a set of values. Is that mean, median, or mode? That is mean. So
that's the mean.
Is not the correct answer. It is not applicable for qualitative data analysis. The answer is mode is applicable for data analysis, right? So mean, median, and mode. So that's that. It is resistant to outliers. Can this be true? Yes or no? That is meaning that no matter if the values increase or decrease, mode will be mode no matter what. So can we say C is the correct answer?
Yes, C is the correct answer.
Very good. Okay, last one over here. This one, Dr. Ethar. Which one of this is the correct answer?
Changes would most be expected.
Okay.
A group of investigators conducted a randomized control trial to compare the effectiveness of rivaroxaban to warfarin for ischemic stroke.
Okay.
Patient 14,000 participants were enrolled, and 1/2 was assigned to each of the cohorts. Patients were followed for 3 years. Conclusion of the trial: the incidence of ischemic stroke in participants taking the new drug was 1.7 compared to 2.2 warfarin. Hazard ratio is calculated 0.79. 95% confidence interval was blah, blah, blah. If the study was conducted with a total of 7,000.
Okay, 1 second. Now I want to ask you guys a very important question. If the 95% confidence interval contains the value 1, is this statistically significant or not significant? Dr. Ethar, what do you think?
Not significant.
There you go. So is this statistically significant?
Yes.
Yes, very good, because it does not contain 1. Okay. Which of the following changes would be expected?
Okay, I chose for this one type 2 error. What was that? Decreased type.
So you chose error. Now look, if you decrease the number of the participants over here, did the sample size decrease? Yes or no?
Yes.
Okay. If the sample size decreases, then can we also, does the power of the study, does it also decrease? Yes or no?
Yes.
So shouldn't there be increased rate of type 2 error if the power decreases?
Oh, yes.
Right. So your choice is not correct. Okay.
Yeah.
So number 1. So now over here, if we decrease the sample size, can we increase the confidence interval range? Yes or no? For example, let's say for 2 people, there's a 50-50 chance. Yes or no? For 2 people, there's a 50-50 chance. For 3 people, there's a 33% chance. Yes or no?
Yes.
Okay. So if we decrease the sample size from 3 people to 2 people, what happens to the number? Does it increase? Yes or no?
Increase, yes.
Yes. So the correct answer for this one is increase. Now the thing is, increased of what? Increased of selection bias? No. Increased of confounding bias? No. Increase of confidence range? Yes.
Yes.
Okay. Please read another one, Dr. Etha, very quickly, since you are here.
Campaign, increased vaccination rate against human papillomavirus. Increased vaccination rates would have which of the following effect on the pap smear or pap test?
Okay.
I chose A, true negative rate.
You chose A. Now, public health increases vaccination. If you increase vaccination, then does this decrease the prevalence or incidence?
The incidence.
This decreases the incidence. Very good. Okay. And if you increase vaccination, does more people become negative if incidence is decreased, or does
Yes.
more people become positive?
They become negative more.
Okay, so over here, if they become more negative, then increase of true negative rate. Which one did you choose? Yes or no? Which one did you choose?
I chose A, that the true negative will increase.
Okay, increase true negative rate. Let's see if this is the correct answer. I don't think this is the correct answer.
Okay,
true negative rate is not influenced by incidence or prevalence. Okay, because true negative is dependent on the module of the test, right? Sensitivity, specificity, true negative, true positive are only an indication if your test is a good test or a bad test. So all the true positives, true negatives, they're all wrong. Over here, you have decreased positive predictive value. Is that a correct answer option? Yes or no? The answer is that positive predictive values. No, they are. I'm going to tell you why. Because if you have vaccination, then the prevalence is also decreased at one point. For example, let's say in month 1, incidence is decreased, but eventually the total amount of people who will be diagnosed with cervical cancer with vaccination, will it also decrease? Yes or no? The answer is yes, right?
Yes.
So if prevalence is decreased, then positive predictive value also decreases. So decreased positive predictive value is the correct answer for this.
No.
Okay. Okay. Yeah. Thank you so much, Dr. Ithar. Who else is here? Dr. BK, help me out with this, please. Very fast.
Which of the following is most likely to have affected the validity of the study? A clinical trial is conducted to determine the efficacy of ginkgo biloba in the treatment of Parkinson's disease. A sample of patients with Parkinson's disease is divided into 2 groups. Participant in first group are treated with ginkgo biloba and participant in other group receive placebo. A change in a movement disorder society United Parkinson disease rating scale score is used as the primary endpoint for the study. The investigators, participants, and data analysts were meant to be blinded throughout the trial. However, while the trial is being conducted, the patient's demographic and their allocated treatment groups are mistakenly disclosed to the investigator, but not to the participants or the data analyst because of technical flaw.
Okay.
The study concludes that there is a significant decrease in MDS-UPDRS score is
treated with ginkgo biloba. Now, very good. Okay, so over here, what is the problem? What is the bias? What is the bias? The bias is what? Can anyone tell me what the bias is? Okay, so over here, the bias is what? Can we expect that over here, the physicians, the researchers, they were meant to be blinded, but they weren't. The patient's demographic and their treatments were mistakenly disclosed to the investigators. So if the investigators now know who's taking what, are they observing? Yes or no? So yes. Can we expect this to be an observer expectancy bias? The answer is yes. Okay, which one of this represents observer expectancy bias? Assortment bias, procedure bias, effect modification, recall. The answer is
Pygmalion.
Very good. Pygmalion is an observer expectancy bias. Okay. Next one, Dr. Who is helping me out right now? Dr. VK. Yes, Dr. VK. Let's do this.
Assuming the investigator intend to keep the level of significance at 5%, Which of the following changes would be most effective to increase the statistical power?
Very easy question.
A group of investigators is evaluating the efficacy of intranasal ketamine in decreasing.
Okay, one second. Just 1 second. My apologies. You don't even have to read the whole question to do this. Which of the following would be most effective to increase the power? If you want to increase the power, should you decrease type 1 or type 2 rate?
Type 2.
Type 2. Very easy question, right? Let's move forward. Dr. BK. Okay, let's do this.
Which of the following sets of characteristics best describes the clinical trial phase?
Okay.
A group of investigators is planning a phase 3 clinical trial to assess whether the histone deacetylase 3 inhibitor BG45 should be used in the treatment of multiple myeloma.
Okay. So now you have the study purpose and you have the study population. Okay.
Yes.
So which one of this is the correct answer? At third stage, the third phase, what do? Do we affect if there is any improvement, yes or no, from the standard care? So which one of this is talking about improvement from the previous treatment? B, yes or no, against the standard of care. Okay, efficacy and safety against the standard of care. And in the third phase, do we have small sample size or large sample size?
Yeah.
We have a large sample size. So B. Are we clear, yes or no?
Yes.
Okay. Next one, Dr. Otero, very quickly help me out with number 61. And thank you, Dr. BK. Dr. Otero, please read this question.
Hello, Doctor. Yes. Which of the following type of bias is most likely to have influenced these results?
Okay. Yes. Then read the question.
You read the whole page.
Okay. You know what? Let me read the whole thing. A group of researchers conducted a study to determine whether there is an association between folic acid before pregnancy and ASD. The researchers retrospectively surveyed 200 mothers. All participants were interviewed and about their prenatal consumption. 94% rate was obtained. The study was found that folic acid was associated with a significant rate of odds ratio. Which of the following type of bias most likely should be influencing this? This is a very easy question. The answer is recall bias, right? Because recall bias is what we see in a retrospective study. 62. Based on this information, which of the following is the most appropriate measure of association between MDD and unprovoked seizure? Okay. Appropriate measure of association of MDD and seizure. Which one of this is the correct answer? They're trying to see the association of MDD. So shouldn't we form what? Should we calculate relative risk or odds ratio? The answer is we should do odds ratio, right? Because this is a case control study. Since this is a case control study, we should do odds ratio. So 20 times 70 divided by 35 by 16. This is D. Yes or no? Okay, next one. I think we did this before. Did we do this before? Yes or no? The study is best described. So we want to assess the safety and the toxicity of this study. So the correct answer for this one is phase 1. Okay, this one. Which of the following best describes the study design? Did we do this? Yes or no? This is a crossover study. Very good. I think we did this before. This is a crossover study. 65. We also did this. This is an ecological study. So this is the last one. Based on the information, what is the 15-year risk for distant recurrence in patients with high-grade breast carcinoma? What is the thing that we want to find from over here? What is the thing that we want to find from over here? We want to find the absolute risk, yes or no? What is the risk? 15-year recurrence for this one. So which one of this is the correct answer? After an observation period of 15 years, the relationship between tumor grade and distant recurrence was evaluated. The results are shown over here, so well differentiated. Based on this information, 15-year risk for distant recurrence in patients with high grade for which one? So over here, so for high grade, the 15-year recurrence should be 550 divided by 550 plus 1950, yes or no? So this should be 550 by how much? 1950 plus 550 is how much? That's 2500, yes or no? So 550 divided by 2500, this should be the correct answer. Okay, so they just want to find the risk of this, as simple as that. So this by the total amount. Are we clear, yes or no? Okay, good. How many of you guys are aware that next week, Monday, we will have an evening class for step 1? Did you guys know this or not know this? Yes. Yes, okay, good. So if you guys want to register for this class, please send us an email. And if you want to refer a friend, I will highly appreciate if you guys can refer a friend for this. If you guys have a friend who is equally struggling with step 1, ask them to join the class by reaching us out on this page. Okay, ask them to reach us out on this page over here. And over here, ask them to reply with their email address. Okay, if they reply with their email address, then I will give them the link and they can start the class for free for 1 week. Okay, so that's that. Thank you so much. Okay, does anyone have any questions? I guess not. If you like our lecture, please go to the page and provide us with a review or a rating. I will highly, highly, highly appreciate this. Okay, all you have to do is go to reviews, and in the reviews, you can share your review or feedback. I will highly, highly appreciate this. This allows the students to see if we're the right fit for them or not. So that's that. Hope you guys have a very good day and a very good weekend. I'm going to see you guys next week, Monday. Okay, bye-bye.